Edit it now.
Ready? Good. We're watching for the finger. It came up. It was this finger. Okay.
Get it.
Oh, you guys have bad minds. Welcome to Labor and Health. Once again, I will welcome you to Evanston. This is not in my district, but in order to get here from anywhere in Wyoming, you had to come through my district. Couple of quick facts. What's anybody have any good facts about Evanston or Uintah County they want to share? Nobody. Okay, I'll share one. Bear River, which flows through here. If you've seen it, it goes by through the state park out here. That is the longest running river in the United States that does not go into the Atlantic or Pacific Ocean. Do anybody know where it goes?
Gulf of Mexico.
The Great Salt Lake.
Oh,
It is the largest tributary of the Great Salt Lake. And coincidentally, the Great Salt Lake has raised 6 feet this year. So, and it's still nowhere near where it used to be.
a lot more.
That being said, welcome to Southwest Wyoming, specifically welcome to Evanston. And there's a lot to do here, outdoor capital recreation of the world. Southwest Wyoming is home to the best hunting and fishing in the world. In some cases, our mule deer took quite a hit this winter. As I said yesterday, a month ago, this was white. It was not green. It looks great right now, but there's a lot less deer than there were because they didn't make it through the winter. As one of my patients once said, you have to be tough to live in Wyoming. And some of the mule deer weren't tough enough because, well, some of the people weren't tough enough, quite frankly. This was a tough winter. So welcome. You'll notice on your agenda today, there is no end time. I have a goal here in my head. I'm not going to share it because that would jinx us. We will get out of here earlier than yesterday if we can, because we have a lot of people that have a long ways to travel, and you know, we appreciate you coming to our side of the world. Senator Dockstader had us up in Kemmer 2 weeks ago, and that was excellent. Maybe next interim we'll get you back to Kemmer in this committee, but we appreciate you coming over here. We don't often get to see everybody's smiling faces over here, and we like to see you. So let's start off here this morning. The first topic, we're going to break away from the agenda here real quick. I believe Representative Chadwick has something we want to bring up that we talked about briefly yesterday, but we didn't flesh out all the way. So I will turn some time here to Representative Chadwick first.
Thank you, Mr. Chairman. We kind of all got stuck in neutral yesterday when we started talking about nursing home administrators and failed to bring a motion for the LSO to draft draft legislation that would provide for temporary permits for nursing home administrators. And so at this time, I so move.
And I don't believe this requires a motion because I don't think there was a motion made yesterday, if I'm not mistaken.
Give me a second.
Or a second. I don't think we need a second. I think that we will go ahead and do a discussion, and if so desired by the committee, if there's a motion made, we can have a bill drafted if that's the desire of the committee. So if everybody's familiar with that, you have a handout in your packet, I believe, that specifies what the nursing home administrators are looking for. If anybody needs a review of that, perhaps let's bring the hospital association up front real quick and just get a quick rehash of that so we know where we're at and what we're talking about, and then we'll entertain a motion and entertain discussion. Mr. Boley, go ahead and give us a brief review of what we're talking about.
Thank you, Mr. Chairman, committee members. Eric Boley with Wyoming Hospital Association and Leading Needs Wyoming. As we discussed yesterday, there's a need to fix in statute the ability for the Board of Nursing Home Administrators to issue temporary licenses. For years, they have been issuing those temporary licenses, and just recently they were informed by the Attorney General that they didn't think they had that authority. This doesn't change anything that's been done. It just codifies and allows them to continue that practice. And the reason that this is necessary is there is turnover a lot in my hospital administration and also in nursing home administration. We've seen a tremendous amount of turnover. Under regulation, each nursing home has to have a nursing home administrator to be in compliance with both state and federal law. So this would just allow them, in the case of, let's say a nursing home administrator leaves, but they have someone in their management that has experience, but hasn't gone through the test or the training to receive a nursing home administrator's license. This would allow them to receive a temporary license for up to 6 months. If you have someone that is in training, administrator in training, it's called AIT course, who is in the process of earning their license, and they have to go through a course, then they have to sit and test and pass that test. This would allow them to have a temporary license while they're in the process of receiving that permanent license. Or in some cases, it would allow them to issue a temporary license to for someone to come in and serve in that position that does have that experience. It's just a really helpful tool that we've been using, and we just need to have that authorization that we thought we had. And I'm not even the board, but that they thought they had put into statute. So we'd ask you to favorably consider passing this legislation.
Questions from Mr. Boley, committee? There's one. Go ahead, Representative.
Thank you, Mr. Chairman. So can you explain this just a little bit further? Because, you know, I have many or a few licenses that I test for that allow me to do certain things with work where, you know, it's a long process to study. It's a fairly large test. I take the test, and I mean, sometimes on the test, I know immediately what the results are, but you know, maybe not. What's the time frame? And then, you know, I can't, and there's reason why I can't do a job, why I can't work until I get those test results back, until I'm fully certified officially. So, you know, kind of explain that a little bit more, you know, the downside to this if that would happen. Thanks.
Mr. Boley.
Mr. Chairman, Representative Hornick. So I went through this process 20-something years ago. I spent 6 months doing the administrator and train. And we're talking about 3 different scenarios here. So one of them is the administrator and training course, working to becoming a fully licensed nursing home administrator. So that's what we're talking about here. So I studied, I had to basically run the nursing home or shadow the existing administrator for 6 months. Had to hold meetings with staff and do all the different components of becoming certified. There's a manual that you can buy and study, and it has sample tests and all kinds of things. And then you have to travel to a testing center. I had to drive down to Salt Lake to get mine. At the time, you took the test, and then it was it's not immediate. It wasn't immediate results then. It may have changed now. It's been 20-something years, but you took the test electronically and then drove back home. And I think I waited 3 or 4 weeks for an envelope to arrive to let me know if I passed or not. And I was really glad I passed the first time, because I'm not sure I would have done it a second time. But in the process, I was fully up to speed and ready to run a nursing home. I just couldn't get my official license at that point until I had the test results, and then went through the background checks and the application process with the Board of Nursing Home Administrators. They knew I was in that process, so it wasn't. They actually let you let them know when you enter that course. So that's one scenario. The other one is a hospital CEO or director of nursing that's worked in the nursing home for a number of years and has the experience, but they don't have the license. This temporary would allow them to fill that position for 6 months until they can hire someone. And it's an onboarding process. It's not something we can do immediately. You have to do a search, and sometimes nursing home administrators leave suddenly or need to leave suddenly, and it creates that void. And so this just creates that opportunity for us to make sure that we have a licensed nursing home administrator in place for up to 6 months with a temporary license.
Further questions, committee? Representative Ward.
Thank you, Mr. Chairman. I'm just making a comment. I would support this motion because in my view, it reduces regulation, which I'm for.
Thank you.
Senator Hutchins, I see a hand in the air. down
Yes, thank you, Mr. Chair. Just a quick question. Does the temporary license have limitations on it for that administrator? Or is it, you have the full Monty, you can do whatever you would do if you were full, hired?
Mr. Boley.
Mr. Chairman, Senator Hutchins, it basically gives you the ability to run the nursing home. You have your day-to-day meetings, you make sure they're required to make sure you stay in compliance with all the rules and regulations that you're delivering the care. It gives you that ability for 6 months to operate the nursing home.
Further questions, committee? No, we had a motion to talk about this. We need a motion to have a bill draft. Moved by Senator Dockstader to have a bill drafted, second by Representative Ahern. Any further discussion, committee?
Eric seconded.
Eric's got his green light on. Go ahead, sir. No. Good, I didn't want to hear. Oh, Eric Boley does. Barlow.
Seconded, yeah.
Okay, we got a first and a second. It's a slow start to the morning. I will tell you, my listening track, my soundtrack was James Taylor, Jim Croce, and Preston Gunderson. So I'm a little slow starting this morning. It's an advantage when I have a soundtrack to come in, but sometimes it's a disadvantage. Okay, we have a motion and a second on the floor to consider a bill draft. And I believe we have that proposed bill draft in front of us. We have that. So the language is all there. If no further discussion, let's have a vote. All those in favor of this motion to have LSO draft a bill, please say aye.
Aye.
Opposed, say no. Okay, that passes. LSO has the directive to draft that. I believe we have one further motion. It's not necessarily a motion, it's an item of discussion that Representative Ward has for us. I will turn the time to Representative Ward.
Thank you, Mr. Chairman. I move that the committee consider to write a bill to repeal Wyoming statute 14-1-101B6, which allows a minor aged 12 to 17 to seek tobacco cessation help without the knowledge of the minor's parents. In compliance with this law, Banner Health sent a communication to parents of children turning 12 that they could no longer access their children's online health records. And parents were understandably upset about that, and it made the news. So I think it's a no-brainer that parents need to be the primary stakeholders in their children's health, and that they have a right to know if their 12-year-old is seeking tobacco cessation treatment. Therefore, my proposed repeal of this law.
Committee, excuse me, committee comments or discussion on that motion? Okay, we need to take some. Oh,
Statute one, oops, sorry,
Who's
Mr.
speaking?
Chairman, I'm sorry.
go ahead, Senator.
Can we get that statute one more time?
Go ahead,
Mr.
Representative.
Chairman, if I may. Thank you, Mr. Chairman. I sent everyone an email about this at 6:03 PM last night. The statute is 14-1-101B6.
Okay, go ahead, Representative.
Thank you, Mr. Chairman. Does anybody know the history on why this law was put in place in the first place? I mean, where,
I believe they do, and I think we'll have some, I know there's some public testimony on it. Who wants to talk about this, and they can fill us in on what the history and where it came from. It involves some federal law, and so we want to make sure that what we're doing and what we're looking at here. So yes, we'll hear that here in a few minutes. Any further things? Go ahead, Representative Chadwick.
Thank you, Mr. Chairman. So as I understand this, the parents aren't excluded from that information. It's just that they can no longer get it through the hospital portal. It's available at their request online. It is also available if they stop at the hospital and request that information. So the information is not obscure or unavailable to the parent. It's just not available on the portal anymore, on the hospital's portal. It's as I understand it, more of an IT thing than anything else is why that is not available. Thank you.
Representative Ward.
Thank you, Mr. Chairman. Most parents access their children's health records online, and most parents were understandably upset when they received this communication from the hospital.
Okay, Senator Barlow, I believe I saw your hand up, sir.
Thank you, Mr. Chairman. So let's be clear. I think the motion was to have a bill draft prepared for the consideration at the next meeting.
Senator Barlow, can I get you
And if-
just a little bit louder? We can barely hear you, sir.
Weaken up and
Go ahead.
Most people would say that's an advantage. Most people would say that's an advantage. But Mr. Chairman, so I want to be clear, the motion was to have a bill draft prepared for consideration at the next meeting. Is that accurate? Thank you.
That is accurate, sir. We're just going to take some brief public testimony. We're not going to dwell here for a long time today. If indeed we do draft that, then we'll discuss it more in depth.
Apparently I have poor service again. My apologies.
Yeah, that's okay. And we're just happy to have you with us from far away. By the way, you can't get any further away from us than where you're at, so welcome. Okay, with that committee, let's just get some brief, just a few testimony about it, just some background if we can. I know we got somebody online. I don't know if there's anybody in the room that wants to talk about it. If there is, please come forward real quick. I say we don't want to dwell a lot of time here because it's not on the agenda. We're just doing this as special. It vaguely relates to some of our topics, so I don't want to spend a lot of time here. Mr. Boley, go ahead, sir. Any information you might have.
Mr. Chairman, I don't know if it makes sense to have Wyoming Medical Center go first and explain what happened. I believe Marilyn Schickish and Lance Porter, the CEO, are online.
And that would be fine as well. Let's bring Mr. Porter in if we can, please. Excuse me, go ahead, Representative Warren.
Thank you, Mr. Chairman. I wanted to relate to the committee that I spoke with Lance Porter on this very issue, and he confirmed that statute was the reason for the communication sent. Thank
Very
you.
good. And I suspect he will reiterate all the conversation. I too have had a conversation with him. So go ahead, Mr. Porter, if you give us a quick background and discussion on the issue and how it came up.
Good morning, everyone. And yes, I did have a very good conversation with Representative Ward and others on the committee today. And I appreciate your time. So yes, our policy does apply to this statute, but there are other statutes, and we did provide some talking points that list those statutes that we have to follow as we are preparing patient information for parents. And so it's not just the tobacco cessation that we're dealing with. So I would hate to see legislation drafted just addressing one of those issues. You're correct that it is an IT issue, really. Our patient portal does not have the ability to filter out protected information from non-protected information. You're correct also that parents can go online and request their child's medical records. They can also come into the hospital and get those medical records, but it will not include the protected information. And again, that's because we have to follow, and every hospital will follow the same rules because we cannot provide protected information to parents when it's protected by these state statutes for their minor children ages 12 to 18.
Questions, Mr. Porter, Senator Dodson.
Mr. Porter, Mr. Chairman, Mr. Porter, what's a quick example of protected and non-protected?
Go ahead, Mr. Porter.
So again, we handed out some exact some talking points on those statutes and those exact numbers, but there are STD testing, tobacco cessation, drug treatment programs, Planned Parenthood information. Mary Lynn, would you add anything to that list if I hit everything?
Morning,
And then of course, I'm sorry, also where you have child who has been emancipated, so they've joined the military before age 18, they've got married before age 18, or they're supporting themselves financially 100%, then the parent no longer has access or right to their access to their medical record.
Further questions, Representative Ward.
Thank you, Mr. Chairman. Mr. Porter, when we spoke, I believe we agreed that this is the only law that keeps parents from accessing the online records of their children at age 12. Is that correct?
Mr. Porter.
Thank you, Mr. Chairman. Representative Ward, I believe we sent you a list of all the statutes that are involved for that. Am I mistaken? Did we not give you that?
Representative Ward.
Thank you, Mr. Chairman. Yes, Mr. Porter, that was sent, but this is the only law that restricts parents from being able to see medical records from age 12 to 17 of their children. The other laws don't apply at age 12. I'm trying to make sure that parents of 12-year-olds have access to their children's online medical records.
Any comments? Go ahead. If you wish to reply.
Thank you, Mr. Chairman. So that is a very good question. I will have to go back. I was of the impression that all those laws went into this guidance that we have on what information we can share with parents and which we can't. When I read that and when our legal department read that, it was all of these laws that we provided for you that went into that decision.
Yeah. Further questions? None. Ms. Skissich, I believe you're online there as well. Anything to add to this conversation?
No, Mr. Chairman, thank you for the opportunity to speak. And we would very much, as Lance said, seek clarification for all the members of this committee and truly appreciate Representative Ward's leadership on this. We presume we were following state and federal law and perhaps a further clarification. The communications that we received is from the HIPAA compliance attorneys that this is such a complex area. So I think having this issue come forward gives us an opportunity to maybe get some clarification going forward for this next session.
Questions from Ms. Skissich? Seeing none, thank you very much, Marion. Okay, go ahead, Mr. Boley.
Mr. Chairman, committee members, Eric Boyth, Wyoming Hospital Association, and I've been trying to prepare for this. I actually saw a newspaper article over the weekend. I think we're talking about several different rules. There is a state rule, but there's also HIPAA, which is a federal rule, which is the Health Information Protection and Portability Act. And there are exceptions to what a parent is able to access under the HIPAA laws. I think we're talking about two different issues here. I think we're talking about the ability for parents to access an electronic health record. And then I think we also need to take a look at the federal law, which is HIPAA, on what parents are allowed to access once they get into that electronic health record. I think we're also talking about, in this particular case, an IT issue. Some of our electronic health records have the ability to compartmentalize or to redact those specific instances, and it's smoking cessation, examination, and treatment for an STD, sexual assault care. If the parent or guardian of the minor cannot be located promptly with diligent effort, those are the exceptions. So some EHRs can pull that out and the parent can still access the electronic health record and they wouldn't be able to see those specific pieces. Some electronic health records don't have that ability. And that's why in the case of Wyoming Medical Center, they offered the parents the opportunity to come in and get a hard copy, a copy of the medical record that would have that information redacted would be my assumption. As far as HIPAA is concerned, it's a huge law. We've talked about it for years. Whether we like our federal laws or not, there's a whole bunch of laws I don't like. I don't like driving the speed limit. I'd like to speed across the state so it doesn't take so long. But HIPAA it's a messy one. So if we start violating HIPAA, if we pass state law that requires our hospitals and healthcare providers of all types to breach or violate HIPAA, we immediately have to self-report ourselves to the Office of Attorney General. And we end up paying huge fines and penalties for that. Could be jail time. There's all kinds of ramifications to that. So I think there are some tentacles to what we're attempting to do. I'm a parent. I understand the desire for transparency and the ability to look at those electronic health records or at the medical record. That's not being denied. The parents can still access that medical record. It's the portal. And in this case, because the IT won't allow it or can't redact that information, they have to restrict the access to the electronic health record.
Just a quick point of clarification is that among all the hospitals in Wyoming, there are several different electronic medical records. Some are able to do that. Banner, I believe, uses Epic. I don't know which one they have. Mary Lynn, is it Epic? Is that correct?
Cerner, Epic has the fix.
Yeah,
Okay.
Cerner's one.
So that's a consideration that the committee needs to understand, that there's several different electronic medical records. Some have capability to sort that out, some don't. With that in mind, Senator Dockstader, you have a question.
Thank you. I'm slow this morning. So our concern is that we're going to have certain information that should not be made available publicly to slip that out because not all digital platforms are the same. It's not an equal situation, but the parent is still allowed to go into the physical facility and pick up that information on that child, correct?
Mr. Chairman, Senator Doxer, yes, and the parents actually received a notice saying you can come in and get a copy of the medical record at any time.
Thank you.
Further questions, Representative Ward?
Thank you, Mr. Chairman. Mr. Bully, are you aware that 45 CFR 164.502, which is the HIPAA privacy rule, states specifically that it doesn't preempt state law to the contrary? That's my first question. My second question is, are you aware that most parents access their children's medical records online?
Mr. Bully?
Mr. Chairman and Representative Ward, I'm looking at 45 CFR 164.502G, and there are exceptions. I'm not interpreting exactly the same way you are. And I would say that it's a generalization to say that all parents or most parents are accessing their kids' electronic health records online. I don't think we have statistics to back that up. I think there are parents that access it.
Chairman Swanson?
I would just say, working at a hospital anecdotally, at least at our hospital, most of the parents don't access their children's medical records online. They actually do the request in paper and get their paper copies. And it's not a very common occurrence, really. Most people know what their kids are doing and get a copy when it's necessary for legal or law enforcement reasons. But
You know, the electric portal, and I would just add to this, working in a healthcare facility, the electric portal is still in a transition phase. People are still learning about it. And I think it will become more common, but at this point, I would agree with the co-chairman. It's not the predominant way of getting into medical records or making appointments or anything else for that matter. But it's changing, and in time it will change and it will become the majority. But right now, I think we're still in that transition phase. Further questions? Go ahead. Follow up.
Mr. Billy, just general question. So I understand this statute. I think my fear is we take this statute out and then there's another state statute that, and I think Representative Ward said this would allow at least 12-year-olds. I don't know what the next age step, maybe it's 14, maybe it's 16. So part of me says this isn't the fix for the issue, but then when I think what the fix for the issue might be, it's probably going through and saying, what can we do to ensure parents have access to their kids' medical records in a more responsive fashion? And that could be a very large interim topic to go through. I think Mr. Porter, Ms. Shickich said they sent a list of all of the statutes. I don't know if they can provide that or if you have that on you as well, but if someone does have a list of maybe all the statutes that require that minors do have some medical record rights, to send that to the committee, I would be most appreciative. But that's my question or concern. Is exempting this one statute going to solve the problem, or is it a bigger problem than one statute?
Mr. Bully?
Mr. Chairman, Chairman Swanitzer, I think we need to research this a little bit. I'm not completely prepared for it because I thought the topic might come up. I do think that Ms. Schickish did provide some of those. I don't have it in email, but I think she could provide it. I do think it could be a slippery slope though. And I don't disagree that parents should have access to their kids' medical records. There are certain things that are protected.
Representative Penn, I believe you have your hand up. She's had it up there for a little while. Go ahead.
Thank you, Chairman Baldwin. My question would be probably for Mr. Porter. So these statutes aren't new, EMRs are not new, so why this now? Also, I would say I would support the motion, given that we still have one more committee meeting, that if it's determined later on after more research that this isn't necessary, then we can scrap it at that time. But given that we only have one more meeting, I would certainly support at least getting things going, getting a draft made, and then reviewing it again in Saratoga.
Thank you. Any reply at all? You wish? No.
Mr. Porter.
Mr. Porter, any reply?
Thank you, Mr. Chairman, and thank you, Representative Penn. That's a very good question. Yeah, why is this coming up now? And the answer to that is because in September of last year, we transitioned to a new platform of Cerner. And it's the platform that goes throughout the entire Banner Health system. The reason for that is simple, so that if you see Karen Wheatland and are transferred to Wyoming Medical Center, it's the same platform, it's the same medical record, and that information flows smoothly. But we just transitioned that in September. And so now we're starting to see that, and not everybody accesses or requests medical records. So it has taken a little, several months for that first case and that first notification go out where somebody actually read it and questioned it and had an issue with it. But I did speak with, for example, the CEO of the hospital in Wheatland, and they have dealt with this on a case-by-case situation with people in their communities. And he said that they address them on a one-to-one situation, and they've never had a situation where they felt this needed to be escalated, or the family member felt that needed to be escalated beyond that explanation. But these questions have come up before in other hospitals within Wyoming.
Very good. Senator Bashar has a question.
Thank you, Mrs. Chairman. I heard how difficult something is once again, and it's a software issue, and we can go down the list. But as far as what HIPAA does not have any restrictions on information that isn't tied to the state. Basically, I'm looking at a legal lawyer's website. Says HIPAA offers no protection to minors and requires healthcare providers to release their information. And then when you look at the rule 227, it basically says it talks about how the state is the one that does this. So this is a simple issue here in front of us on one little piece of the code. And when you look at it, the minor is 12 years old. It's placed in an emancipated section where there are other reasons for people to be emancipated. This isn't one of them. This is not. We shouldn't emancipate this issue just because it's. I mean, however this got here, and it probably came through with tobacco funds because it's tied to 94-1204. And I looked in those statutes. I could not find anything that directed this. So I think that we should move this. It's a state issue, and the software providers probably do this in different states. They know how to do it differently. It's not that difficult a problem. It's no different than when I said the auditor could open the books, and I was told it was going to cost millions of dollars, and then the auditor came in and opened the books. It's not a problem. We should be fixing this for the parents so they have access at any juncture in the system where they have the ability to see a minor's records. And quite frankly, I don't want somebody handing me a piece of paper. I want to see what they got on the system.
Okay, I'm going to make a suggestion here because I don't want to dwell here a long time, not being on our topic list. And that would be, we have a motion on the floor to have this drafted. Did we have a second?
Second.
We had a second down by Senator Hutchings. And my suggestion is this, that we not go a lot further in-depth discussion right now. If the committee chooses that they want this drafted as a committee bill, we will then have that discussion at Saratoga meeting, which makes the Saratoga meeting even more interesting. But with that in mind, with that directive, rather than delve deeper into this issue, which I think we're just scratching the surface, and maybe there's more that we need to research and we need to know, and LSO can help us with that as well, that we go ahead and move forward. Would the committee be in agreement with that?
Yeah, agree.
Okay, I believe the committee's in agreement with that. Lots of head shaking. So with that motion on the floor, all those in favor of having this drafted, if you can restate that motion one more time for us, Representative Ward, as well as LSO has that.
Thank you, Mr. Chairman. I move that the committee consider drafting a bill to repeal Wyoming statute 14-1-101B6.
Thank you, Representative Ward. All those on the committee in favor of that motion, please say aye.
Aye.
Those opposed, say no. That motion passes. We will have that bill drafted and available for our Saratoga meeting. Thank you very much, committee. Okay, that brings us to item number 1 at 8:40 a.m., which means we're only 20 minutes behind. We're going to catch up.
Sure, that's what I said yesterday too.
Yeah, I'm optimistic. I believe that brings us to the Governor's Office Health Task Force. Ms. Davis, welcome to the front row. If anybody on the committee noticed nobody sits on that front row, if you look on television, you'll notice that that's the only row that's visible on the TV screen. Nobody sat up there today. We learn, we're teachable. Go ahead, Ms. Davis.
Good morning, Chairman Baldwin and committee members. I'm Jen Davis. I'm Governor Gordon's Health and Human Services Policy Advisor. Thank you so much for having me today. What I wanted to share with you all today is just an update of what the Governor's Health Task Force is doing and any ways that we can help support this committee and their work. We have been meeting with the Governor's Health Task Force for about 2 years now. We have a robust, large stakeholder group that meets quarterly, and then we have a smaller working group that meets usually monthly on a regular basis to discuss specific issues that we're tackling. In addition to that, we have multiple subcommittees that are working on specific targeted issues around healthcare. So I'm just going to give you a little update about what we're doing, give you an opportunity to ask any questions that you might have regarding the Health Task Force, and then any thoughts if there's something we can do to help support you all as well. So with that, in the slides that you have, the first slide is just the 3 priorities that we are focused on during this interim session. The first one is healthcare workforce. As you all know, that's been a big topic for many years, especially since the pandemic. This has been a challenging area, as you've heard in all of your committee meetings, the difficulty with finding healthcare workers in Wyoming, and not just in Wyoming, but across the nation as well. The other is cost and access to healthcare in Wyoming. That was the initial charge of the Health Task Force from the governor. And as you all have been working, as you know, it's super complicated, and that has led us down multiple paths of where we can specifically focus in on some of those areas. And lastly, on there is behavioral health, which we know there is a lot of effort going on around that. We're in the midst of the community mental health reform, and there is the subcommittee that you all have on the mental health and vulnerable adults that is focusing on that, and also the education committee is taking on youth mental health as well. So the behavioral health work that we're doing is more around the governor's priority of awareness and really focused on the summits that we've done and some of that work, which I'll describe a little bit further in the next slide. So the next slide that you see there is really talking about who is in the healthcare workforce group. So just want to spend just a couple minutes here talking with you all on this because it has been a big discussion over the years. What we had found as we started talking about this is there were several groups working on healthcare workforce across the state. So we had the governor's WHIP initiative, which had a healthcare subcommittee. We had the Health Task Force that was working on it. Workforce Services has some specific work they're doing in the healthcare space. And so what we talked about was bringing all of those efforts together into one place so that we all could be on the same page moving forward about how to tackle this complex issue. So as part of that, the leads that we have in this work based on combining all of those together is President of LCCC, Joe Schaefer, who represents the Community College Association, Curtis Biggs from the University of Wyoming, who is instrumental in the WHIP project, Holly Simone from Workforce Services, myself and Lachelle Brandt in our office, and also Lauren, who is in our office that is the executive director for WHIP. In that, then we have engaged different individuals from the Hospital Association and many other partners, as you see listed on here. What we did was we looked at the data in the state and where we have shortages in the healthcare space and drilled it down to, there was really 5 buckets that we looked at. But what we have prioritized is the nursing pipeline and the mental health pipeline for workforce, and really looking at how do we ensure that we engage kids in high school, and then having pipelines available for them to enter into the workforce at the highest level possible, should that be where they want to go. So we're looking at that both in mental health and in nursing. So with that, some of the WIP proposals that were approved in the first round and in this just most recent second round went into healthcare services. So there were some expansions of nursing programs. There was a practical nurse program stood up. We also increased the capacity for the addiction specialist out of Casper College. It's the only one we have in the state. So their capacity now will be able to bring more students into that program. So now we're focusing on looking at more of those entry level positions. How can we get high school students more interested in healthcare fields? And then also looking at how do we pair with our WWAMI program, our WICHE programs, and really just taking a comprehensive look at this to really see where our needs are, our projections for the future, and figuring out where we need to build capacity in both the educational space and with having preceptors within our healthcare facilities across the state in all these different fields so that people can actually then work in them instead of sending students out of state to precept and then they don't come back. So that's a lot of the focus of that group. So in the next slide, you'll see that our focus has been on cost and access to healthcare. So our main focus, which is an interim topic that you all have, is EMS. We've had an EMS subcommittee for probably about 1.5 years now. And that subcommittee really came up with ideas that helped drive some of the ARPA proposals that were approved through the legislature the year before about doing the pilot grants, some stabilization funding, and also putting in the emergency medical dispatch for all of the medical dispatch facilities in Wyoming now are all operational at the same level of training for their dispatchers. So that was some of the initial thing that came out of the committee to really focus on that.
You mind, I think we got a question down there.
Oh,
If you don't
sure.
mind. Go ahead, Representative Ward.
Thank you, Mr. Chairman, and thanks for testifying, Mrs. Davis. Did you want to finish or can I?
No, go ahead, please.
Thank you so much. So I have a question about the previous slide regarding the healthcare workforce. So you mentioned that nurses and mental health professionals are in dire need. And my own daughter would like to become a nurse. What's slowing her down or making her hesitant is the fact that the nursing program requires vaccination with COVID vaccine. So if that could be taken away, and I'm asking, will the nursing programs take that away? Will the mental health programs take that requirement away? That could go a long way in getting more people to enter that field.
Ms. Davis, if you don't wish to reply, go ahead.
Sure, Chairman Baldwin, Representative Ward, that has come up in the discussions. And we are hearing that as a barrier for some students entering healthcare fields, nursing being one of those. That is a lot of the discussion. Where it comes in is the schools have had to have that requirement to meet the requirements of their preceptor facilities, which often are hospitals, and have had that requirement placed upon them. So I think as we learn more, as some of those requirements have been relaxed around vaccinations and all that, we'll be able to hopefully learn a little bit more in that space. But we do realize that is a barrier for some individuals wanting to enter healthcare fields in general. So good point to bring up, and that's definitely something on the radar.
Just aside to that, and this, you may or may not know the information, Ms. Davis. Do you know how many nursing programs are within, just in the state of Wyoming? How many programs, how many we have available?
Chairman Baldwin, I did not bring that with me, but I can get it to you because I do have that information. We pulled all the data around the state, so I can definitely share that with the committee.
Very good. I think that's pertinent to this discussion because that is a facility by facility or school by school, which will change. Okay.
Correct.
Oh, one more quick question. Go ahead, Senator.
For letting her know it's going to be quick. I
Speak-
appreciate that.
Speak up close to your mic if you would, please.
Thank you. Ms. Davis, the question, you brought up a topic that we see all over the country, everywhere. The next topic, same thing. The youth have no desire to work anymore. So you're saying we need nurses, we need doctors, we need this, we need firefighters. What are you is your group doing, or what are some of the initiatives that you think you guys can do to encourage people to go into these fields? When I was a kid, if I can remember correctly, we had like career days in school where you had a firefighter come in, a police officer come in, someone's dad come in and explain what their job was, because most of the moms were at home making cookies. So what is your group thinking about doing to encourage people into the workforce?
Ms. Davis, and I just throw in a piece there, and the Workforce Development Council is spending a lot of time in this issue. If you're interested, sitting in on one of our meetings, one of the many meetings I go to. Ms. Davis, go ahead.
Chairman Baldwin, Senator Hutchings, Chairman, you're exactly correct. There is a lot going on right now through the Workforce Services Office. And it is a lot of the discussion that this group has had as well. How do we really generate interest, especially with kids in our K-12 system? How can we start them thinking about what opportunities are out there in all different professions, not just healthcare, but for our purposes, we've been looking at healthcare. And that has been a lot of the discussion that we've been having with the K-12 system of how can we integrate programs into curriculum? How do we do more career health fair days? How can we do some more job shadowing? That is something that the Office of Workforce Services is looking at. How can we do some unpaid internships during the summer to just generate children's interest in going in different fields? And so they are working a lot with the industry leaders to really think about how we can do that. There's also a project in the state called Next Gen that is really focused in industry. It's industry led. And so there's an opportunity for those programs there too, to think about that at the most local level of what their need is, and then how they can start doing different things to engage hopefully younger individuals and people looking for a career change to see what opportunities are out there. So it's a big lift. There's a lot to it.
Very good. Go ahead and proceed.
All right, thank you. On the EMS that we were talking about, currently we are still meeting with the EMS subcommittee. What we're really looking at is exactly the conversations that you all are having here after I'm done talking today about how do we really sustain this system? How do we look at helping with the movement away from a volunteer workforce and all of the challenges that the current EMS system has. I know that you all are looking at a bill today around essential service, has been a topic of discussion for the entire period that we've had the EMS subcommittee, and thinking about having an essential service, but then how do you pay for that? And so I think there's a lot of work to continue to do in this space, but we have a lot of momentum. I think there's a lot of interest from you all. I think there's a lot of interest from the public of ensuring that in an emergency, somebody shows up. So that is something that we hope to continue to work with all of you and figuring out some options for solutions in that space. So also with that, one of the other things that we're looking at in the cost and access is looking at alternative payment models, which again is very complicated with the charge of looking at decreasing healthcare costs. As many of you know on this committee, it becomes very complicated and most times just ends up in cost shifting, which we don't want to do. We don't want things to be shifted onto consumers and raise the cost of healthcare for them. So it's really challenging. We've been talking about different things that we can do in this group. And so we'll continue those conversations. And then lastly, we've been talking about doing a lot of public education. So some of the discussion that we've had is how do we educate individuals about health insurance plans, what to look for in a plan, where to go to buy them, talk about healthcare service availability, like what's available in your area, where do you need to go somewhere else in the state, where are services that you need to may need to seek outside of our state. So just really helping to inform the public to be better consumers of healthcare. and affordability. What do they need to look for in a plan, and what does it mean when you have a high deductible plan? So that is something that we're continuing to talk about, developing a campaign there. Lastly, what we are working on is the governor's mental health initiative. And so with that, we have, as I already mentioned, the many things that are happening in the legislature right now. Department of Health also is looking at a youth needs assessment for mental health services. We also have looked at where all of our ARPA dollars went during all of the money that came in and how that was invested and what does that do to our current infrastructure for mental health in the state. And then where do we have any gaps remaining? So that's a big focus that we're looking at. In addition to our efforts through the governor's mental health summit work, is really just an opportunity to educate the public and bring awareness that mental health is an issue that is very important to all of us. We all have mental health, just like we all have physical health. And how do we talk about that in a way that destigmatizes the conversation? So we've had the 2 summits that we have put on in Casper, have had great attendance, great conversation, are really focusing on the 3-branch approach to behavioral health in Wyoming. How can the executive branch work well with the legislative branch and the judicial branch to really make meaningful change in the state? We also have been putting together some roundtable discussions with some targeted stakeholders to talk about what is a vision for Wyoming in the next 2, 5 to 10 years around behavioral health, and what is it that we need to do in order to accomplish that. So as you all know, the big part of that is what you all have done through the state hospital, the Life Resource Center, this community behavioral health reform, and then what else do we want this to look like in Wyoming, just beyond what government is responsible for, but a whole system. And then lastly, we are doing regular webinars to help educate the public, and anyone who wants to attend, they're open broadly. We're doing a variety of different topics. We just finished a series on innovations in Wyoming of different things that people are doing at the local level to help engage their communities. We're taking a break from those this summer, and we'll relaunch those in September with PBS kicking us off, talking about their series that they're doing. And again, just for promoting awareness, programming in January, we're looking at doing a webinar that will talk about all of the different suicide prevention training programs that are available in the state of Wyoming, what the differences are in those, who the target audience is in those, how do you find a trainer, how do you sign up? So a lot of those things will be part of that webinar series then, so that people know if they're looking for training, they know exactly which type they should be looking at that would meet their needs. So those are just some of the quick updates around the governor's health task force. Again, really want to be part of helping to support the work of this committee and helping be a partner to you all and working through a lot of topics. I know your time is limited. You all have other things that you do outside of legislature. And so really want the opportunity to just let you all know we're here to be a resource for you. We have legislators that sit and participate with us on the panel. Would invite any of you at any time if you want to participate, listen in. I would welcome that at any time. So I am here to answer any questions that you might have.
Questions, committee, Senator Dockstader.
Yeah, thank you. Good presentation. Jen, I share this with you. I went to a good presentation in Jackson. I wasn't sure whose responsibility it is to bring these forward at the local level or the regional level. So our mental health providers, other services in the community. As I recall, the one in Jackson wasn't exactly mental health, but they still put together a good program. Who's supposed to take the lead in these things at the local level?
Ms. Davis.
Chairman Baldwin, Senator Dockstader. So for suicide prevention, substance abuse and tobacco cessation. We have the community prevention programs that are ran through the county. So it's money that you all have appropriated for these prevention efforts that flow through the Department of Health into each of the counties. So each of the counties have these prevention coordinators within them. And then they are helping at the local level to develop programming based on the local need. So the program that you're referencing, Senator Dockstetter, that I attended to in Jackson was put on by that group. So Beverly Shore is the community prevention coordinator there and is helping to coordinate efforts at the county level there.
Thank you.
Mhm.
Further questions, committee? Seeing none. Thank you very much.
Thank you all very much.
Do we have any public comment on that presentation? And I would be remiss if I don't recognize our representative who came in the room. He's not from this neighborhood, but we'll welcome him anyway. Representative Stivar, welcome to our committee. We'd give you a round of applause, but we don't have time. Thank you for coming. We appreciate the interest in our committee. No public comment here. Is anybody online? If you wanted to raise your hands, raise it. I don't see any raised hands. Okay, committee. You're almost getting close to back on time. We're only 25 minutes behind. Oh, 15 minutes behind. We gained some ground there. Next item on the list is organ donation. We have a bill draft that's been prepared, 24 LSO 0078. LSO. Occupy the hot seat if you would. Anna is shuffling her papers. She's excited to get up here. Welcome, Ms. Johnson. Go ahead and put it out there for us.
Good morning, Mr. Chairman, members of the committee. This is bill draft 24 LSO 78, organ transplant recipient protection. On the top of page 2 in the bill, this draft provides the definition of organ transplant recipient. And then this draft goes on to amend Wyoming statute 2620-803 to include organ transplant recipients. It prohibits individual or group life insurance policies or long-term care insurance policies from denying or canceling coverage for an organ transplant recipient. It also prohibits the denial of eligibility or continued eligibility to an organ transplant recipient under a policy. It prohibits these policies from reducing or limiting coverage or benefits or increasing premiums for organ transplant recipients. And then policies can't preclude a covered person from receiving all or part of an organ or tissue through transplantation as a condition of continuing to receive coverage under a policy. And policies also can't preclude a covered person from receiving medical services or other services related to organ transplantation. There is an applicability section in section 2 stating that this bill draft only applies to individual or group life insurance policies or long-term care insurance offered, issued, renewed, delivered, or issued for delivery in Wyoming on or after July 1st, 2024. And then there is an effective date of July 1st, 2024. And I would stand for any questions.
Questions, committee? Seeing no questions, thank you very much. Committee, if you remember that this was brought forward as a relief, we had protection for the organ donors, but not for the recipients. And this was brought forward as a means of protecting the recipients. Any discussion, committee, before we move public comment? Representative Swan, who are you?
Chairman, co-chairman, Mr. Co-chairman. Just a quick question for Anna, just because it says it's sponsored by me, is that just because I'm the co-chairman of the committee instead of being sponsored by the committee?
Mr. Chairman, you'd asked that I draft this bill in between meetings, and so I didn't know who to put it under. So you asked for it, so I put your name on it.
All right. Thank you for clearing that up for me.
Yeah. We like to see your name, even though I can't remember it.
Yeah.
So yeah, this would be a committee, so that we'll make that change to appropriate time.
Okay.
Discussion before we move to public comment, committee. Seeing none, public comment. Anyone in the room wish to comment or discuss this? Come forward, even though you sat 2 rows further back than you did yesterday. Go ahead, introduce yourself and let us know your thoughts.
Mr. Chairman, members of the committee, my name is Tana Howard. I'm the Deputy Insurance Commissioner. I was really going to come up, Mr. Chairman, and give the background of why this bill came up, but you already did it for me. So I really don't have a lot. It's just a consumer protection, adding that protection for the organ donor recipient, in addition to last year, the legislation for the donor themselves. So I will stand for any questions. We're neutral on the bill. We have no issues. We think it's a consumer positive bill.
Questions? Representative Clausen.
Thank you, Chairman. Ms. Howard, have we seen this as a problem in Wyoming? Has this come up, or is this more of a preventable type issue?
Ms. Howard.
Mr. Chairman, Representative Clauston, we have not seen this as an issue in Wyoming. We have 0 complaints with the department related to organ transplant donors or recipients getting coverage. This has been a national push over the last few years. We've seen several organ transplant related bills through national organizations that have just expanding and making sure that there's consumer protections involved for those. So it's just been a national push. We have not seen any complaints in our department related to this issue.
Further questions, committee? Seeing none. Thank you, Ms. Howard.
Thank you.
Okay. Any further public comment in the room? Seeing none. Anybody raising their hands online?
No.
No hands raised. Okay, committee, I'm going to close public comments. Discussion of the bill. And what's your pleasure, committee?
Mr.
Go ahead,
Chairman,
Mr. Co-Chairman.
I would move Bill Draft 78 as a committee sponsored bill for the 2024 session. And also the stipulation, this was one of our interim topics from Management Council, and I didn't feel like it needed to be scheduled for 3 meetings. It was a pretty cut and dry, simple conceptual bill. So it didn't get as much work as other kind of committee assignments, but if everybody else feels confident with it, I'm perfectly acceptable sending it to session.
I would agree. It's pretty straightforward. Who seconded that? Okay, representative. So we've got a move by Swanter and a second by representative. Any comments, committee? This is Representative Ward.
Thank you, Mr. Chairman. I kind of echo the question / comment from Representative Clauston. If this hasn't been a problem, what problem are we trying to solve? And do we need a new law to solve a problem that's not a problem?
Anybody wish to address that question? I would go ahead, Mr. Co-Chairman.
Mr. Chairman, I'd just say that if you ever had a problem in this area, once is too much. So not that we do a lot of proactive kind of preventative things in the insurance world, but if there was to be some kind of complication where someone was denied after getting an organ transplant when they're at their most vulnerable, it probably seems like an okay stipulation in our law to ensure that they receive coverage. There are some minor concerns when it talks about post-operative treatment, counseling, et cetera. You know, we always think of major organ transplants, but there's, you know, some, I'm not sure there's a minor organ, but there are some that might not require the full range of treatment and service options. And I don't think I want anybody to, you know, be trying to game the system, but I think it's pretty standardized language that other states are doing. And if enough states do it, as you all know, insurance is mandated, regulated at a state level. And we have consortiums and national groups to try to keep our laws to be similar to prevent the federal government from coming in and, you know, overseeing insurance. And so this is just another small step of trying to have some uniformity as other states are doing. So the more our states are kind of in unison, the less likely the federal government come in and mandate something else.
Further questions, discussion, committee? Go ahead, Senator.
Thank you, Mr. Chairman. I'd like to give the committee a simple idea of what happens. An insurance company would pay for a transplant, and after the transplant, then they would exclude, could exclude one of them. So this would be a protection for that person that gave the donor kidney and the person that has the received the kidney. So I mean, we know it's a good procedure on one end, but on the other end, we're going to say we're going to blacklist you. So that's kind of what this does. It's a good bill.
Agreed. Representative.
Thank you, Mr. Chairman. As Ms. Howard mentioned, it's been a push lately. I had a donor in my district, and that's why I brought the donor bill last year. And then Senator Barlow mentioned, what about the recipients? So that's why I got put on the Management Council. I think it's a good bill. Again, thank you.
Thank you. And I would add to this, when we talk about organs, and I believe Chairman Zonter, Co-Chairman Zonter mentioned it, we think about kidneys and we think about hearts, but we need to think about more than that. This is skin, this is eyes, this is, you name it. Every organ in the body, there's minor and there's major. To me, if I donate anything, I think it's major. But that, just keep that in mind, that this involves a lot of things. Any further discussion on the bill committee? Seeing none, we have a motion and a second to make this a committee bill for the 2024 session. This will be a roll call, I believe.
Mr. Chairman, this is a roll call for 24 LSO 0078 organ transplant recipient protection. Senator Barlow,
Aye.
Senator Bouchard,
Aye.
Senator Dockstetter, Senator Hutchings,
Aye.
Representative Chadwick, Representative Plouston,
Aye.
Representative Hornock,
Aye.
Representative O'Hearn,
Aye.
Representative Penn,
Aye.
Representative Trujillo,
Aye.
Representative Ward. Aye. Representative Yin,
Excused.
Representative Zwonitzer,
Aye.
Chairman Baldwin,
Aye.
13 aye, 1 excused.
Okay, committee, that will be a committee bill for the upcoming session. We'll assign that to a house in the future when we're finished in Saratoga. Okay, committee, now we're going to move into a new section, new topic. We're going to move in the EMT firefighter section here. My intention here, we're going to hear first from LSO with the presentation. You have a research paper that Donna has done for us. That's where we'll start. And then my intention is we'll hear from Shad Cooper, Fire Chief Cooper, about the baseline of all these issues. And then what we will do is, rather than do them all at once, we're going to take a couple at a time. We'll do 2 bills at a time, take care of those, and then move forward to the next 2. So that will be the intention. So let's start with Ms. Shippen, going to talk to us about her research, which is quite interesting, actually. Go ahead, Ms. Shippen.
Thank you. Hello, Mr. Chairman and members of the committee. There are actually 2 research products in your meeting materials. I'm going to talk first about the fact sheet. LSO was asked to look at the history of EMS in Wyoming. And so what I prepared was a statutory history looking at laws that have been enacted regarding EMS. The fact sheet on page 1 starts with laws that have been enacted to establish and regulate EMS services in the state, starting with the Wyoming Emergency Medical Services Act of 1977. Page 2 lists laws enacted to provide benefits or incentives for EMS workers and volunteers, and then also laws to provide state or local funding for EMS services. I'll talk in a little bit more detail about those because I know EMS funding was another area that LSO was asked to look into for the committee. In 2008, the legislature appropriated $2.5 million in general funds to reimburse hospitals and ambulance services for uncompensated care. In 2009, the legislature established the EMS Sustainability Trust with $500,000 from the Tobacco Trust Fund. And that trust was established for the purpose of providing grants to EMS agencies. These grants are for needs assessments to determine a master plan for sustaining EMS services, and also for grants to implement the master plan. Then if you look at page 3 of the fact sheet, in 2016, there were 2 bills passed to clarify that special districts, improvement and service districts, hospital districts, and rural healthcare districts could provide EMS services and levy taxes to fund those services. Then in 2021, there was legislation passed to establish a UPL program to provide Medicaid supplemental payments to ambulance service providers. And then in this year, in 2023, there was an amendment to the Improvement in Service District statute to provide an alternative method for initiating an improvement in service district to provide EMS Rather than a landowner petition, there could be a resolution by a board of county commissioners to establish an EMS district. And I'll talk a little bit more about those special districts that can be formed to fund EMS when I go over the research memo, which is what I'm going to do next. So this should also be in your meeting materials. This research memo covers kind of a broad area because the committee had asked for information not only on the history of EMS, but EMS funding and information regarding other states that have designated EMS as an essential service and that provide state funding for EMS. So the memo starts off on page 1 with a brief history of the development of EMS systems in the United States. And it all started back in the 70s. EMS started as a federal initiative, and there was federal funding provided to states to establish state EMS offices and EMS regions. In the 80s, that categorical federal funding for EMS was replaced with block grants to states. These block grants are called Preventative Health and Health Services, or PHHS block grants. The block grants did not specify that the money had to be used for EMS. It was provided to states to be used for a lot of public health services. And that's when the shift started to happen. Once states had discretion to use those monies for other purposes, the responsibility shifted to local communities to then fund their EMS. Just in a footnote here, footnote number 2 on page 1, I did receive information from the Department of Health about Wyoming's PHHS block grant, which is Wyoming currently receives about $350,000 from the federal government in that grant. About $25,000 of that money is allocated to the Department of Health for the community EMS program. Then if you look at page 2 of the research memo, at the top of the page just again talks about how EMS funding, responsibility shifted to local communities. States, did manage EMS differently, and the system kind of became fragmented. Then the second section, EMS funding, I looked at nationally, how are EMS agencies generally funded? And there are 2 sources of funding, local taxes and insurance reimbursements. We heard a lot about insurance reimbursements at the April meeting, and this kind of repeats some of that information for you. EMS is classified, EMS providers are classified as transportation providers, not healthcare providers. So typically insurance, Medicaid, Medicare will only reimburse for transport, not for non-transport care. So a lot of EMS services go uncompensated. I give some national data here. 27% of responses are uncompensated. And as we heard in April in Wyoming, about 35% of Wyoming's EMS responses are uncompensated by insurance. A handful of states, if you turn to page 3 at the top, a handful of states, including Wyoming, do allow Medicaid reimbursement of non-transport patient care, but the reimbursement rate is small, and the total reimbursement that's been provided to Wyoming EMS providers is also small. You'll see I give figures that the Department of Health provided to me for 2022 and 2023. We're talking less than $3,000 distributed among 4 to 7 providers. Starting in January 2024, those EMS providers that want to bill Medicaid for non-transport services will have to be enrolled as community EMS providers. So because insurance reimbursements are low and often services are uncompensated, EMS providers often have to rely on federal and state grants and private donations to cover their operating costs. As I talked about in the fact sheet, Wyoming does currently have what's a grant program called the EMS Sustainability Grant Program that was established in 2009. However, that program doesn't provide grants for equipment purchases or operating costs. As I said before, it provides grants for needs assessments. I should qualify that in last year, 2022, Wyoming, the legislature did appropriate money from the ARPA funds that were received, the federal ARPA funds. And but as you know, those are federal funds, not state funds, and that's time limited. Those are time limited funds that have to be spent by the end of 2026. There was money appropriated, $5 million to EMS stabilization, but that won't be ongoing funding. So then on page 3, I get into talking about Wyoming EMS funding. Currently, there, 62 EMS agencies in Wyoming. They're operated and funded by a variety of entities, cities, counties, fire districts, hospital districts, joint powers boards, and rural healthcare districts. Unfortunately, those EMS services that are operated by counties or cities have to compete for county and city revenues with other county and city services. There are also constitutional and statutory limits on the amount of money that cities and counties can levy to support their services. The Constitution limits county property tax levies to 12 mills, city levies to 8 mills. I'm at the top of page 4 here. And currently all but 3 of Wyoming's counties are at their maximum 12 mil levy. Wyoming statute does allow for the creation of 4 types of special taxing districts, which can provide EMS services. So fire districts, hospital districts, improvement and service districts, or rural healthcare districts. Again, EMS services that are operated by hospital districts or fire districts have to compete for funds with hospitals and fire departments. Rural healthcare districts and improvement and service districts, on the other hand, can be formed for the specific purpose of providing EMS. But currently, there are only 4 rural healthcare districts in the state that do provide EMS, and I was not able to find any improvement and service districts that provide EMS. Table 1 on page 5 just summarizes the statutory authority those 4 types of districts have for levying taxes, and also what's required to initiate formation of those districts. And then on page 6, table 2 summarizes the 4 rural healthcare districts that exist in the state that do provide EMS services. And those 4 districts are able to generate enough tax revenue that they cover most or all of their operating expenses. And you'll see that detailed in table 2. Again, going on page 6, I talk about the EMS Sustainability Trust Grant Program. And then on page 7, I get into the information that the committee requested regarding states that designate EMS as an essential service. I only found 8 states that have declared EMS an essential service in statute. 4 of these did so back in the 1970s, 70s and 80s when they were creating their state EMS offices. And then in recent years, 4 more states have passed legislation declaring EMS an essential service. And I'll talk a little bit more about those 4 states. Again, on page 7, if you go down towards the bottom of the page, I talk about Tennessee and South Carolina that enacted legislation in 2021 and 2022, declaring EMS an essential service and requiring each county in the state to ensure at least 1 licensed ambulance service is available in that county. However, the statutes both specify that counties are not required to appropriate county revenues to fund those services. In 2022, Alabama declared EMS an essential service, but it was for the purpose of saying that both public and private EMS agencies should be eligible for funding. And again, it didn't require, the Alabama law does not require county governments to provide or fund EMS services. In 2021, Iowa enacted a law which gives counties the authority to designate EMS as an essential county service for the purpose of enacting additional taxes. Since that law was passed, 8 Iowa counties have initiated ballot measures to declare EMS an essential services, and 6 of those ballot measures have passed to allow those counties to levy additional taxes. And then on page 8, I get into how other states fund EMS. So I only found 9 states that provide state funding through either direct funding or competitive grant programs. Most of these states generate revenues through additional motor vehicle registration fees or other fees. And the state funding models kind of fall into 3 categories. So I found one state that I'll talk about in a minute, Hawaii, that assumes primary responsibility for funding EMS in the state. Then I found a couple of states that share responsibility with counties for funding EMS. But most of the states, most of the 9 states just supplement local funding with competitive grant programs. So again, on page 8, the one state I found that assumes primary responsibility is Hawaii. And this goes back to the 1970s when Hawaii passed a law establishing their state EMS office. The state took responsibility for funding services in the 4 counties of the state. However, the state has kind of pulled back from that. A couple of years ago in 2021, Hawaii passed a law shifting responsibility for EMS services in their largest county, their most populated county, Honolulu County, to that county. So now the state is just responsible for funding services in the other 3 counties. On page 9, I talk about the 2 states that share responsibility with counties for funding EMS, Delaware and New Mexico. Both of these states use general funds to support county EMS services. If you look at the information on Delaware, you'll see that similar to Hawaii, though the state of Delaware has pulled back the amount that they fund. They started out in 1990. The state passed a law saying that the state would provide 60% of the funding for county EMS services. Under current statute, the state now is responsible for 30% of the cost. And then if you go to page 10, I talk about the remaining states that supplement local funding of EMS. Again, most of these states generate the revenues to do this through motor vehicle fees, moving traffic violation fees, the licensure and certification fees they collect for EMS agencies and EMT providers, and a variety of other fees. Most of these states provide these supplemental funds through competitive grant programs, and most of those grants are used to support ambulance and equipment purchases and personnel training and recruitment. One state, Ohio, which you can read about on page 11, did a few years ago establish an economic hardship grant that provides financial support to EMS agencies that are in financial trouble. So that concludes my summary of the research memo, and I'm happy to answer any questions.
Questions for Ms. Shippen? Thank you very much for that. That's a lot of research and a lot of information. Senator Dockstader.
Just for clarification, the difference, some states saying EMS, all of this is essential, others are not, but yet everybody is doing it. What is the benefit of being declared essential?
Ms. Shippen.
Mr. Chairman, Senator Dockstader, it seemed to be more semantic to me than, states declaring EMS essential then because they do it for different reasons and don't necessarily, even the states that require counties to ensure those services don't require counties to fund those services. So it didn't seem to be very meaningful.
Thank you. And that's my great fear here, committee, is that we do what, and tell you, New Mexico and I don't know, South
Delaware,
Carolina.
Mexico and Delaware are
Delaware.
the two that.
And they mandated it as an essential service and then said, no, we're not giving you any money. Counties, you're on your own.
Oh, okay. I'm sorry, that I misunderstood you. It was Tennessee and South Carolina.
Yeah,
Yeah.
that's
Mhm.
my great fear. That's the county's great fear. That's a lot of people's fears. So we say, yeah, it's an essential service. You got to do it, but we're not going to pay for it. Figure it out.
Mhm.
So that's a great danger. Okay, committee, any further questions? Senator Hutchins, go ahead, ma'am.
Thank you, Mr. Chair. Donna, this was a very good report. I appreciate you going through it. Looks really nice. On page 1, you mentioned, I believe, at the very bottom paragraph in 1981, you talked about how the states received money, and then in the footnote, Wyoming received 350,000 for PHHS. And then they decided to share some of that money with other agencies in the state. I don't think that was smart. Why don't you keep it in your pocket? Because that's what it was there for. Is there a way they can recoup that money? Say, okay, we're not going to share it anymore. We need all of this to operate.
Ms.
Yeah.
Shippen.
Mr. Chairman and Senator Hutchins, just to clarify, yes, in 1981, what had been categorical federal funding provided to states specifically for EMS was replaced with a block grant to states, and then states had discretion to use that block grant for a variety of public health purposes, and as many states chose to do. And then that footnote talks about the amount of money that Wyoming currently receives in that block grant and the amount that Wyoming, the block grant goes to the Department of Health, and then the amount that the Department of Health allocates to EMS. It's up, my understanding is it's up to department discretion how they use those funds. And it's not a large amount of money that Wyoming
Right.
receives, 350,000.
Mr. Chair,
Go ahead, ma'am.
if we can continue, it's not a lot of money, but it's money. And if they're in need of it, do you know if they can say, hey, we want to spend it all on EMS, not on dividing it or at our discretion? Our discretion is EMS and EMS only. Can they do that? Do you know?
Mr. Chairman, Senator Hutchins, I think perhaps the Department of Health would be better qualified to answer that question.
Very good. Further questions before we let her go back to her comfortable seat? Oh, it's exactly the same seat.
That's okay.
Okay. That being said, Chief Cooper, would you like to come give us some background before we delve into annual bills? Come on up. The only two guys in the room wearing white shirts. That's because you're not eating donuts. If you were eating donuts, you wouldn't wear a white shirt. Yeah, but it's covered. Go ahead and introduce yourselves and give us some way forward here. Go ahead.
Mr. Chairman, members of the committee, my name is Shad Cooper. I'm the fire chief and county fire warden for Sublette County Unified Fire. I also have the pleasure to serve as a president of the Fire Advisory Board for the Wyoming Rural Firefighters Association. Actually, introduce yourself.
Good morning. I'm Chris Coker. I'm the fire chief in Worland with Worland Fire Protection District and Worland Volunteer Fire Department, as well as the Washoe County Fire Warden and the Regional Emergency Response Team 6 for the state of Wyoming, as well as past president of the Wyoming Fire Chiefs Association.
Thank you, Mr. Chairman. Would you, just following your format, would you like me to go through each of the bills and just speak to each one individually, or how would you like?
Why don't you save that, Chief Cooper? Just save that. Just kind of give us a background of why we're even here. What are we doing? And then we'll give you a chance as we discuss each bill to put input on each one of them, if you would.
Understood. Thank you. So, Mr. Chairman, I've I've been a firefighter for 28 years and fire chief for the last 9 years. I've been working with the Wyoming Fire Service to address significant reduction in availability of volunteer firefighters throughout the state of Wyoming. Approximately 2 years ago, we started working together with our various associations and bodies to understand the depth of the problem. We conducted a survey with our membership, which we shared with you in April. And the results of that survey was that this is not a unique or a local problem. It's a statewide issue. And we're all in this together. We wanted to work with our local, state and fire districts and various forms of government to try to address it. And so we wanted to come before the legislature and ask for your help. And we requested an interim topic to research the issue and try to find solutions for the problem and try to figure out what we can do to stop the gap and even go so further as to improve our recruitment and retention efforts and try to bring firefighters to our respective fire departments, and once they do join, to try to keep them with us and try to get as many years of service as we can for those various benefits that are available.
Questions for Chief Cooper? Committee? Seeing none. Oh, there's one at the end of the table again. Senator Hutchins, go ahead, ma'am.
Thank you again. Thank you, sir. We spoke earlier, we had a briefing from the Department of, from the governor's office on workforce services. Did you guys attend those meetings where they talk about recruiting people to work?
Chief Cooper.
Mr. Chairman, Senator Hutchins, are you asking if the Wyoming Fire Service attends the workforce service meetings? Senator, so no, I'm not. We don't attend the workforce service meetings. We do regularly attend, community meetings. Just 2 weeks ago, we had a job fair in Pinedale. We attended that, set up a booth. We actively recruit. It's probably one of my chief responsibilities as a fire chief is I dedicate a tremendous amount of my time to attending community events and meetings and getting the word out and meeting with our citizens and prospective volunteer firefighters and encouraging them to join.
And I would add to that, two of your departments actually had a fish fry. Not very long ago. I just spoke with them last night, but go ahead, Senator Hutchins.
Thank you, sir. At the fair, what was the reception like?
Go ahead, Chief.
Mr. Chairman, so we had a community fair in the local Pinedale Library. There are various businesses and government agencies and Whiteout was there, and several different various agencies were represented. During that meeting, for speaking for my own organization, Sullivan County Unified Fire, we were able to, we have a sign up list. We were able to receive 2 additional names of firefighters from the community that were interested in joining the fire department. Mr. Chairman, with your discretion, furthermore, currently our organization is approximately 30 firefighters short from full capacity. We continue to actively recruit and working, to try to find as many opportunities as we can to encourage, additional firefighters to join the organization.
Okay, go ahead, Representative Clausen.
Thank you, Chairman Baldwin. To either one of you gentlemen, you work closely with EMS. If I'm being robbed and I call 911, I expect a police officer, and if my house is on fire, I expect a fire truck to show up. If I'm having a heart attack, I'm going to expect an ambulance to show up. How do you guys work with EMS? Do you see EMS as an essential service for the state of Wyoming?
Go ahead, Chief Cooper.
Mr. Chairman, I'm not an expert in EMS. I don't provide EMS services in Sublette County, but we do work shoulder to shoulder with our EMS service providers. In Sublette County, it's a special hospital district that provides EMS services. It's funded separately than the fire department is, and they're dispatched separately. But that being said, on a regular basis, we provide lift assist for patients' care. Almost every emergency vehicle incident or car wreck we respond to, when we provide extrication, our firefighters are are trained to at least a first aid CPR level. That's a minimum qualification, but we incentivize our firefighters and encourage them to become fully qualified as EMTs. And then that allows us to be a force multiplier or supplement the availability of personnel on the emergency incidents so that we can help them to provide patient care in the best interest of the, the people that we serve. But we, in Sublette County, we meet weekly with fire law and EMS. We sit down every week and talk about what we can do to continue to improve our services, what happened the previous week, what's coming up the following week. So to answer your question, we work shoulder to shoulder and make sure that we provide the best care that we can for our citizens.
Thank you. Further questions, committee? Senator Dockstader.
Mr. Cooper, you're 30 short in Sublette. Is that Pinedale and Piney?
So, Mr. Chairman, Senator Dockstader, so Sublette County Unified Fire is a county-wide fire department. So we actually consolidated 6 separate independent and autonomous fire departments approximately 9 years ago into becoming a single entity that covers the entirety of Sublette County, including the municipalities of Pinedale, Big Piney, Marbletown, but also the unincorporated areas of Daniel, Bondurant, Boulder. Who am I missing? There's Kendall Valley. So we have 6 stations in the organization. 9 years ago, when we consolidated, we had close to 100 firefighters. Right now, we're sitting right at 70 firefighters. 9 years after the fact. Most of those 70 firefighters have been lost post-COVID.
Follow up.
You're 30 short in all those places you just acknowledged under one unit. We were to go across the state, look at our volunteer firefighting situations. What's the average? Is it 30? Is it more? Is it less? How many are we short in volunteer firefighters?
Go ahead,
Volunteer EMS.
Mr. Chairman, Senator Dockstader, from the survey that we distributed statewide, my estimate is approximately 25% short from volunteer fire services across the state. It varies. There are some that are more than or some that are less than that number. But that was the reason why we distributed the survey statewide, is we wanted to receive feedback from our fire chiefs and ask how big is the problem and how short are we? And that was the number that we came back with.
And that is a piece, but we don't have the EMS piece. That was actually, we got in our last meeting, they gave us a sheet that told it well, exactly from those respondents, but EMS, we don't have the exact.
Okay, and one quick, how many volunteer firefighting units do we have out there of that 25%? How many across the state? This is representing how many units? Take, for example, here in Uinta, how many here? These are volunteer firefighters here, correct?
Go ahead, Shane.
Mr. Chairman, Senator Dockstader, I'm going to defer to the director in the back of the room. He provided that number, and I don't want to misrepresent the number, but in broad terms, there's approximately 4,600 firefighters in the state of Wyoming. I believe 3,900 of which are volunteer firefighters. And I can't answer your question on specific numbers of Evanston versus Kemmer.
Okay.
It's going to be vary by department.
That was the fastest I've ever seen Mr. Matthews move running up here. Go ahead and introduce yourself and give us some exact numbers, Byron.
Mr. Chairman, Byron Matthews, Wyoming State Fire Marshal, Director of Fire Prevention, Electrical Safety. I believe the question, Senator, was total departments. So total departments were approximately 144. There's some reporting challenges annually, but the number across our great state is 144.
Chairman, then of that 144, we're 25% short on average.
Yes, sir.
Thank you.
Pretty good. Further questions? Go ahead, Representative Horn.
Thank you, Mr. Chairman. Something you mentioned, you said that most of, and I'd like to hear it, correct me if I'm wrong in what I heard, but most of those 70 firefighters have been lost post-COVID. So you talked about the numbers going down post-COVID, and maybe I didn't hear the right number, but can you tell me why that has happened in your opinion? Why are we losing firefighters during COVID, post-COVID, when seems like we've all come to a place during COVID where we're supposed to be in this together, kind of thing, So what's going on post-COVID that you've seen, and why is that?
Chief Cooper, or anybody else that's up there who wants to answer.
Mr. Chairman, Representative Hornock, I'll answer the question and I'll defer to my colleague as well to include some additional lights that so prior to COVID, we would maintain an average of around 90 to 100 firefighters. So I've like I said, I've been chief for the previous 9 years, and each year we would lose approximately 10 firefighters, recruits, and kind of maintain stability and keep that, you know, close to that 90 mark. Post-COVID, we've you know, through attrition with firefighters that move away or take a different job or you know decide that, you know, once they've joined that it's not for them, or for whatever reason the firefighters leave for a variety of reasons. When they've left, they've left at a greater rate than I've been able to recruit back. So I've lost more each year than I've been able to recruit back to join the organization. I've asked the same question myself, you know, from our administration. I've also asked the same question from our own firefighters. We had a lengthy meeting with our membership a couple months ago and asked exactly that question. You know, what has changed? Is there something that we can do better? Is there something we can do to better serve, you know, the needs of our membership and you know, fix what's going on? We received a variety of recommendations to improve, but no silver bullet that said this is exactly why there's been a change. I can speculate and provide some anecdotal evidence, but I don't have any empirical evidence to support my position on this. But I can say that I've noticed a change in the demographic in my community. I've noticed a change in remote work habits. I've noticed a change in availability for our citizens to be community and civic oriented and join the volunteer fire department and help their neighbors when they need help. So it's been a gradual change, but I have never seen a nationwide statistic or a silver bullet solution that answers the direct question you asked. With that, I'd like to defer to my colleague as well. I think he has some additional information.
Go ahead, Chief.
Mr. Chairman, this is a nationwide problem, certainly. Being involved with the fire service for 26 plus years, we've seen huge shifts in volunteerism through those times, pre 9/11, post 9/11. We saw it go up a little bit for community spirit, but we've seen an attrition through volunteerism through many years due to the increased ask of our volunteers. The requirements that are statutorily or organizationally imposed by communities competes with families in their free time and their ability to balance their needs of their families. We moved into COVID, and so now we see a post-COVID, and we see individuals much more conservative on what they're willing to give of their free time, what they're willing to do with that, and how they want to interact with communities, whether that's due to the fact of trust or untrust of government, or the additional requirements of organizations. That ask is far greater. We also have individuals that are working to attempt to find jobs with that, or you sit down with somebody and they say, well, I would love to volunteer. However, do I volunteer for your organization, or do I take that second job so I can keep the roof over my head and the food in my children's mouths? So that's a competing interest there that is a detractor. Our society has become much more transient. So individuals move in and out of communities at a far greater rate now. due to their jobs. And so that is a precipitous for some of the loss of our volunteers. In the career fire service, there's no ability to go past 25 without additional compensation. So they lose institutional knowledge there as well. So it is not strictly to volunteer, but it is a nationwide fire service issue. And those are some of the things that are impacting this. Luckily, your committee, Mr. Chairman, has a great opportunity to help do several things today to create a stopgap and provide one of the greatest assets the state has, which is encourage volunteerism and provide opportunity there.
Very good, thank you. You mentioned increased demands, and I don't think the general public, perhaps legislators, don't really understand that commitment. We're talking about training. We're talking about time demands to go to public events. Volunteers do things like water fights. They do things like hot dog cookouts. They stand by at rodeos, etc. Yeah, Christmas lights. They get to hang Christmas lights and flags on downtown streets. I would relate my own fire department. I'm chief of the Kemmer Fire Department. We're short. I'm over a third of our members. We're short, and we haven't been able to fill it. Matter of fact, the last quarter we lost 2. So it's difficult, and that means people can't respond. I'm here today. That's one less person. That might be a third of who would respond. At 2:30 this morning, my pager went off, and the temptation was to say no because I got to get up and drive to Evanston today, but I didn't. I went to the call and then I came down. Regardless, that being the point, are there further questions for these gentlemen? One down at the end, Senator Hutchins.
Thank you. One of the things you mentioned was that you asked some of the firefighters why they were leaving post-COVID. And I was wondering a couple things, so we don't jump over some of the questions. Did you have a demand for vaccinations during COVID? Could that have been a reason?
Chief, go ahead.
Mr. Chairman, no, the Suffolk County Unified Fire did not mandate any COVID vaccinations. We did encourage our firefighters and provided vaccinations at their discretion, free of charge, through the public health, but it was not a mandate.
Great. Follow up.
Go ahead.
Did when you asked them, say, well, I want incentives to stay? If I can have hunting licenses for free, I'm going to stay. Some of the bills that we have proposed, were those some of the things the firefighters say, well, if you do this, I'll stick around?
Chief, whoever wants to answer it. Go ahead.
Mr. Chairman, Senator Hutchins. So when we met with, and I'm just speaking for my own fire department. I certainly didn't meet with every firefighter in the state, but when I met with the firefighters in Suffolk County Unified Fire, we had a lengthy meeting and asked them for recommendations. It was not a quid pro quo, what would make you stay statement. It was what can we do to work together and improve the organization? What can we do to make this better for you to, address some of the conflicts in your life and your schedule and your family needs and your community needs to provide firefighting services. I won't be able to remember from the top of my head. So the results that I got from my own firefighters, they'd asked for mentorship at all levels. They wanted to increase mentorship from our organization. They asked for an individual fire development plan for our firefighters, so increased training to make sure they were ready and for the responses. They asked for longevity incentives. They asked for, we provide what's called a pay-per-call. It's an incentive for our firefighters to it's not an hourly wage, but it's a small stipend for their incentives. They asked for an increase in their pay-per-call. They asked for tax benefits. These are, I'm just listing from the top, and there's 84 of them here that I have with me, and these recommendations I took to heart. But the point that I want to get to is that I've taken the initiative with my own organization, and I'm sure every fire chief in the state could say the same, that they've worked with their membership to try to identify what they can do to, provide incentives and encourage more volunteerism and encourage retention of our volunteers. In my organization, I'm leading the efforts and providing those incentives. I've met with my county commissioners. I've recently submitted my budget and asked for the types of incentives, increase incentives at a local level to address those needs. We just met with our Sublette County Board of County Commissioners and asked for increased longevity benefits. We asked for increased benefits for life flight mass ground-based transportation benefit for our firefighters. So these are the kind of things that I'm working for on a local level. These are not the things that I'm bringing to our state legislature, though, and the reason why is because these aren't things that I expect you to come to my jurisdiction and help me to handle. And instead, when I met with this board in April, we tried to bring statewide problems and ask for statewide solutions. And so that's really what I'm here to speak to you about is what can we do on a legislative level to work together and address the Wyoming Fire Service as a whole and see what we can do to try to find some of the solutions that are necessary.
And you bring up an important thing to my mind is that no fire department in the state of Wyoming works alone. And you three gentlemen are a good example of that. We have organizations. We just completed a competition in Riverton. Those are things that all the fire departments work together. We don't do all the same things. We're a bit like herding cats sometimes, but we do cooperate and help one another. We're going to go to Riverton and help out. We're going to come to Evanston and they're going to help us out with education, et cetera. So that the fire service in Wyoming is unified. They do things together. They do things separately, but they are very unified and have similar goals, or if not the same goals.
Thank you, Mr.
Senator
Chair.
Hutchins, go ahead.
I appreciate that. And one of the things, I don't want you to feel like I'm coming down on you. I just want to understand more because I've spent time talking to different firefighters, trying to glean from them things that can be done. So his comments were just spot on. And your comments, the same. I'm not coming down on you. I just want to know, and I appreciate your answers.
Go ahead, Representative Trujillo.
Thank you, Mr. Chair. I was just curious, do you happen to have a data sheet showing the disparities throughout the whole entire state of Wyoming as far as the shortage of firefighters and maybe incidences that are, well, let me take that last part back. I want to know, does Laramie County, are they sufficient? Is Goshen County short? Where in the state of Wyoming are we actually having these issues to make it, a statewide problem? Because I'd like to assume maybe that Laramie County is fully staffed and doesn't have the issues that maybe another county does. Do you have a data sheet?
Go ahead. And I know committee that we did get that part of this data sheet earlier, our last meeting, but go ahead, Senator Cooper. Senator Cooper, Chief Cooper, you're doing my job today. Go ahead.
Thank you, Mr. Chairman. Representative Trujillo. Yes, when I met with this committee in April, we had provided a spreadsheet, a survey that we conducted amongst the Wyoming Fire Service. That spreadsheet had approximately a 50% response rate, which is statistically speaking a very high response rate. I'm happy to go into that at this point if you're interested, but I'm happy to refer to it and answer that question offline if you would like. But it is available and was provided to the
perhaps just give us a brief. Are there any organizations, are there any fire departments, fire districts in the state that do not have a shortage? Is there anybody in the state that is fully 100% staffed?
Mr. Chairman, answer your question. No, the results from this survey indicated that every fire department, all 23 counties are struggling with this same issue. This is certainly a statewide issue and it's impactful. It's more than normal, status quo attrition of volunteer firefighters. This is a significant problem that's increasing in severity and we're here to work with our legislators to find a solution. And the numbers from this survey are rather frightening in my opinion. It's the survey indicated that the statewide we're approximately 500 firefighters short. And those aren't those are numbers that come to us from our fire chiefs that we asked, what is full capacity, what is current capacity, and what's the difference between the two? And that's the number that I presented from the result of this survey is 500 firefighters statewide that we're seeking and lacking right now.
And further, I would just ask you, did Laramie County respond? I don't remember. Go ahead.
Mr. Chairman, yes, several departments from Laramie County, including Laramie County Fire Authority did respond, and I'm happy to, if you give me more.
Why don't you just give us those numbers real quick if you could? I know there's an expert from Cheyenne next to you if you need help reading. He's younger too.
And actually, if you want to, please chime in.
Mr. Chairman, Byron Matthews again. To answer the representative's question, to speak to Laramie County Fire District number 4, which protects the city of Carpenter and all the unincorporated areas that go all the way to Colorado. That department is approximately 40% short. As a former board of directors member, I can tell you that we struggle to fill the board of directors, let alone people to get on the fire trucks to respond. So, from that aspect, the chief will find Laramie County Fire Authority number, but everybody in Laramie County is having that same struggle. And if you look at the folks that are hiring career and the volunteer, you're seeing a challenge there as well.
Anything further for us, Chief Cooper? Oh, go ahead, follow up.
Thank you, Mr. Chairman. Chief, you mentioned that you don't require vaccine mandates or you don't require the vaccine in Sublette County. Is that true across the state of Wyoming? So do all the fire departments not mandate the vaccine?
Go ahead, Chief Cooper.
Mr. Chairman, Representative Ward, I can't speak for all fire departments. It's not a question I've asked every fire department in the states. It's I'd assume it was an individual decision from the organizations and addressed on a case by case basis, but it's not something I have that information on.
And committee, if you look in your email, Katie just provided for you that raw data sheet that Chief Cooper has in front of him if you want to see specific counties. And I would just tell you for my county, nor did we require vaccine. So anyway, that is an item by item or department by department. Go ahead, follow up.
I thank you, Mr. Chairman. I didn't quite hear you. Did you say that your county does require?
Our county, not our county. I can only speak for the South. I cover South Lincoln Fire District. We did not require vaccination.
Is there any way we can get that information on the whole state?
I'm sure there is, but that we'll probably get the 50% response rate if we get that, but we can go for that. Perhaps LSO can help us out with that before next meeting. We can get that information for you.
Thank you.
Mr. Chairman.
Oh,
Mr.
go ahead,
Chairman.
Chief.
I can tell you that Washakie County and Bighorn County did not require. That was left to personal choice. And we are still impacted.
Mr. Chairman, with your discretion, to answer your question, sorry, it took me a moment. So Laramie County Fire Authority indicated that they're currently 21% short, 25 firefighters short on their full roster. And just glancing here, Laramie County Fire District number 5, currently 20% short. Cheyenne Fire Department currently 10% short. So there's the data is here available for review for each county and fire departments that responded to the survey.
Yep, you've each got that in front of you. It's in your email. LSO just provided that for us. Okay, gentlemen, I think what we're going to do is we're going to let you go back to your seats for a few minutes. I changed my mind just a little bit. We're going to work the first bill alone, and then we'll go 2 by 2. And I would also remind the committee that although we're talking fire right here, right now, fire and EMS overlap a lot. You won't ever talk firefighters, or you won't ever talk EMTs, or you're somehow not overlapping with the other. So keep that in mind as we move forward. But thank you, gentlemen. Don't go very far. You can go back to the same seats that you had.
Thank you, Mr. Chairman.
Okay, committee.
Members of the board or committee.
Let's move ahead and start doing some bills here. Let's do this first bill, then we'll take a quick break. The first bill draft I want to talk about is 24 LSO 0019. Anna, she jumped out of her seat. She was up before I called her name this time. Go ahead, Ms. Johnson. Go ahead and lead us through this one.
Thank you. Mr. Chairman, members of the committee, this is 24 LSO 19 EMS Essential Service Grants. This bill draft provides legislative findings that emergency medical services are essential services. It creates the emergency medical services account, which would be overseen by the Department of Health. Grants would be provided to political subdivisions within the state that are in need of emergency medical services funding. And then beginning on November 1st, 2024, and every fiscal year thereafter, the Department of Health would be required to request an appropriation to fund the emergency medical services account. The Department of Health is directed to promulgate rules necessary to carry out the purposes of this bill draft. And then to qualify for a grant, an applicant shall be a political subdivision within the state, would have to submit an application and operate an emergency medical services program, and also demonstrate a need of funding for personnel salaries, operating costs, equipment, et cetera. The staff comment on page 5 mentions that the committee may wish to promulgate other rules and regulations regarding the qualifications for grants under this section. The staff comment also points out that this is one of many ways that the committee could provide funding for emergency medical services as an essential service. Some states authorize their counties to declare EMS an essential service within the county, which is then funded through a process similar to Wyoming's mill levies. In other states, the Department of Health or a similar agency is tasked with overseeing a statewide EMS system. And then EMS programs are also in other states in any event are funded in several different ways, such as additional taxes, surcharges on traffic violations, legislative appropriations, or the creation of a trust fund. There's also an appropriation section on page 6, and the committee would need to determine an amount for that appropriation. And there's also a split effective date. And I would stand for any questions.
Questions for Ms. Johnson? Seeing none. Thank you very much for that presentation. Let's move on to any public participation, public comments. I know we got some online. Anybody? Let's take the room first. Come on up. He's been dying to come up here all day. Welcome to our committee. Go ahead and introduce yourself.
Thank you, Mr. Chairman. Good morning. My name is Luke Seifert. I am the president of the Wyoming EMS Association. I also work as a full-time paramedic for my financial support. We're grateful that the committee would consider this bill. As you are well aware, EMS is severely understaffed, as we were talking with the fire service representatives here, and then severely underfunded. The research that was done by LSO was phenomenal, if I might say. I think it provided a great description of the beginnings of EMS and then current funding options and models that are done. I also think that there were some important numbers in there regarding things like community EMS and whether or not that provides any financial stability to EMS agencies. And so we are in strong support of an EMS sustainability or essential services grant account and the funding that could provide both now and in the future, thinking long-term and the importance of planning far ahead and not just looking at the short term.
Questions for Luke? Go ahead, Senator Hutchins.
Thank you, Mr. Chair. Sir, when we did receive the history, we were told that there are only a few states that did what we're trying to do here, making an essential service. And what does that really do for you, making you essential? What do you think is going to happen? Are you going to start getting more firefighters? Or EMS people? I mean, what do you think is going to happen?
Go ahead, Luke.
Mr. Chairman, the designation of essential in and of itself, I think, brings an official recognition of the importance of emergency medical services. Obviously, EMS is still in its infancy, right? You see in here 1973. So in comparison to other industries in medicine and then emergency services in general, EMS is very young. And so the idea that the public recognizes EMS as essential, and that statement, I think, pulls a lot of weight with the more with how that's perceived by EMS professionals as they struggle to make call volumes and encounter the many obstacles they face. Knowing that the public supports them is very important. Now, I think that Senator Baldwin, Mr. Chairman, spoke very direct in saying that simply saying that it's essential doesn't necessarily make it essential. Having a funding avenue is imperative, and simply by stating such will not bring to pass that funding avenue, nor will simply stating that EMS is essential fix the issue of the funding sustainability for EMS.
Further questions, committee? Go ahead, Representative.
Thank you, Mr. Chairman. From the EMS that the LSO gave us on page 6, Carbon and Johnson counties are below by approximately $675,000. From the first page of this, there's providing appropriations. How much appropriations, or what's the fiscal note for making EMS whole and essential throughout the state? Thank you.
You can speculate on that, but I suspect you don't have numbers for us. Go ahead, Lou.
Mr. Chairman, thank you. I do not have numbers. I do know that we probably have some good data that we could pull from to give an idea of what in the past it would have cost. That UPL bill gathered a lot of very important and useful data. That perhaps we could see what the actual cost in the past was. However, I will say that we can't really look at the past as the model for the future, because we would be trying to fix a problem by using the same model the problem was based upon. And so, yeah, unfortunately, I do not have even a round figure of what that would cost.
And I suspect that's a number we're going to have to ask for research on. If we can get that, we can get a rough figure, I suspect, but not an exact figure. Further questions, committee? See none. Oh, go ahead.
Mr. Chairman, going into further on your question and mentioning that page specifically, the shortages, I will note that on there, some of them don't mention that they're under contract. Some of them do mention that they're paid through a contract. For example, the Bighorn County Rural Health District is a contract with Cody Regional Health. And so the actual cost to provide those services is not the $388,000 or whatever it said there. That is the contract cost that the Rural Health District pays to Cody Regional Health to compensate for the difference between providing services and the revenue loss. And so, you know, the actual cost of providing services, depending on area and the level of service, varies greatly. I know that some numbers were given previously, and I think those are a little low, but you're looking at, you know, several $100,000 for a BLS service and more for an ALS service. Now you can take numbers such as what the cost is per ambulance, per staffed ambulance, but most of those numbers don't include the admin overhead or the cost for replacing equipment and such. And so we'd be happy to work with LSO and provide some more detailed what the actual cost of doing business is. And I know they've already gathered some of that information.
Follow up, Mr. Chairman.
Go ahead, follow up.
Thank you. I hope you guys are working with the insurance companies, because there's a lot of stuff you guys do that is non-billable. And I'm hoping that we can close the gap some way, that way also.
Go ahead, Lou.
Mr. Chairman, we are. I will say that the biggest hurdle is Medicare, CMS itself, which again, the UPL bill addresses the Medicaid side, and that's a great effort that's being done. Now, Medicare itself, we see averages around 60% across the state of Medicare recipients that use our services. And so again, the cost of doing business and the cost that's reimbursed by Medicare for transportable services is obviously below the actual cost of doing business. And so we do work with our partners especially in private insurance, and they're usually very good to work with. Now, as we see some of the other services like the treat and release or treat on scene, I think that's going to take some data and some buy-in from private insurance carriers to say, yes, we'll reimburse you. I know that CMS is working on something called the ET3, emergency treatment, triage treatment and transport, which allows you to transport to alternative destinations and to treat on scene instead of transporting. And so obviously the funding model is flawed to say that you have to transport somebody in order to receive reimbursement. That just creates a system of waste where we transport people that perhaps don't need to be. And so, and obviously the liability that's encumbered by not transporting is another barrier to just treating on scene. And so, yes, I think you hit the nail on the head that we do need to work with insurance carriers to figure out how to fix the system, including CMS, to compensate for appropriate treatment and transport.
Thank you. Go ahead, Senator Bashard.
Thank you, Mr. Chairman. Can I ask you if you had these discussions in open committee at county commissioner meetings to the same level that we're having here?
Go ahead, Luke.
Mr. Chairman, the EMS Association itself has not traveled at this point to individual counties to have these discussions. That being said, I do know that some agencies, individual agencies do have these conversations with county commissioners. And as is in the report, usually it comes back to a funding necessity, and then it comes back to what they're required to provide by law. And since EMS is not required as an essential or mandated service, that's usually what's pushed aside.
Go ahead, Senator Bashard,
Follow up, Mr. Chairman. So SF 43 was to create districts. So we can't do that. That's up to your county commissioners. So this is a local issue at this point. So that's why I'm asking about this. And I think there needs to be more work there than here. And that's, I mean, have you guys given any thought to that?
Go ahead, Luke.
Mr. Chairman. Yes, I would agree. This definitely, we have a saying that all emergencies are local, and then they spread out as the resources become unavailable or are above the capacity of the local resource. And so on the Governor's Health Task Force, and specifically with Jen Davis in the governor's office, we've had the discussion about the funding model or about tax-based support. And so there are more discussions ongoing. I know there's some concern about the number of special districts and placing an additional burden on those who have property and raising the property tax. And so there have been some other things explored, or there's some discussions started about other different taxing, like lodging taxing for those traveling through the state. I know that those along the I-80 corridor respond to a lot of calls that don't result in transport, and they expend an enormous amount of resources and money to respond to those calls. As well, I know there's, as you saw in the report, there are some other options such as an additional fee on moving traffic violations and other risky behaviors that I think could be explored as well. And so I do think that, yes, this conversation has to have local buy-in and start at the local level, but that we may see in some counties that it exceeds the local resources to provide that.
Okay, further questions, Senator Hutchins.
On page 3 of the bill, there is a portion where it talks about the funds that go into the account. One of the things that I see, and I'm always leery of this, the federal government, federal grants. Is there any fear that you will have to not only, well, once you receive anything from the federal government, that you'll have to abide by certain rules and regulations that you don't now? And then just on the top of my head, I might be wrong, traffic violations, I think constitutionally, traffic tickets all have to go to schools. So that's kind of out of the question. That's just off the topic. But what about the federal grants and what you may have to do to receive them?
Go ahead, Luke.
Mr. Chairman, that's a great question. And the truth is that as ambulances are billing for services, they're required to meet numerous federal regulations by CMS anyway. And so in my grant experience, I've not found really anything that's above and beyond what's already required through normal federal grant processes or by CMS. And so while, yes, I understand the hesitancy, and of course there can always be other strings attached, I'm not sure that they would be any more cumbersome than CMS already makes them.
Okay. No follow-up. We're going to give you a break, Luke. Have a seat. Don't go far. How about those two that are conspiring there, Ms. Davis and Mr. Matthews? Why don't you come up to the table for a minute? As I know you've discussed this a lot amongst yourselves and we've discussed it. I would add the story yesterday at lunch and realize that EMS and medical providers talk about very morbid things sometimes while they're eating. We talked about the old days. My first introduction to EMS was when the morticians were actually the ones that provided EMS service, and the call would come in through the sheriff's. And my brother-in-law was a mortician, and he would get the call and he would grab whoever was at family dinner that day. We would take the hearse and go out on the highway, pick the person up. There was no medical care, but we drove really fast. Those old hearses were fast. That's where this all began, and thankfully it's evolved since then. So Mr. Matthews, Ms. Davis, give us your thoughts and input and ideas, et cetera. Go ahead, Ms. Davis.
Chairman Jen Davis, Governor Gordon's Health and Human Services Policy Advisor. Thank you for the opportunity to address you all on this. As I mentioned earlier in my presentation, this has been a big topic of discussion for the Health Task Force. We have a specific EMS subcommittee and lots of discussion. So I want to just address a couple of the questions that have been asked that Luke spoke to in reference to Senator Bouchard's question around counties and if the conversation has happened at that level. The answer is yes. There's been a significant amount of conversation with the County Commissioner Association they have a health team, and this is one of their priorities in their health team. And we just met a few weeks ago. Some of the issues that we see in EMS is it is operated differently all across the state. So some is private, some is county, some is hospital-based. So there isn't a consistent structure where we can get a lot of the data that you all have been talking about as well for true costs and gaps in service. It's been really challenging to get a lot of that information. We did do a survey with the counties last year, and not all of them responded, but we had a good majority respond about what their actual cost is in each county, how they're paying for that. And so we do have that information, and I'm happy to share that with all of you as well. We did have a lot of conversation about how do you pay for this? If you make it an essential service and there isn't a funding model behind it, it just becomes another unfunded mandate. And so talking about how we look at funding is a wide variety of options when we look at that. To Luke Seifert's point earlier, we have the majority of our runs are Medicare. So Director Johansson and I have been working tirelessly with EMS, both at our regional level and at the federal level, to talk about what opportunities lie. Could Wyoming try some sort of pilot? Is there something we can do to elevate this conversation for our need in Wyoming, especially as we look at our maps and our population increase is aging? So our Medicare numbers are going to continue to rise on how many individuals are utilizing this service. So Medicare is a key component to this, but it's also a place where we don't have control either. So we still have an issue that we have to solve. We hope we can get Medicare on board, but I don't think it's somewhere that we can rely that answer is going to come to us for the non-transport visits, the community paramedicine. Those are things that help in this system, but they're not reimbursed by Medicare. And so as we've talked about different funding models, talked with the county commissioners and that, how do we look at all of these different issues with the new bill, the EMS districts? Some of, I think some of the counties are planning to engage in doing the EMS districts. That was just passed last session. We have heard some are not going to, because if they don't combine with other counties, they don't have the population base to be able to leverage enough money to still pay for their service. And that was why the special district, the EMS district, was placed, because 21 of our 23 counties are already maxed at their 12 mills. So they needed to have a different option to look at. So it's challenging at best. This has been a really, really tough discussion about how we look at infrastructure, how we ensure that there's coverage completely across the state, and then how do we pay for it? Because I think I would say that almost all of our citizens have an expectation if they call 911, someone is going to show up in a very quick time frame with a very high skilled person to take care of them or their loved one. And so it is an expectation of our communities, and figuring out how we do this is complicated. But we are also at a point where the EMS committee, the governor, myself, we have to do something. This is an issue that we have to figure out how to solve, and it's very complicated. So I don't envy any of you, but just know our office is here as a partner to try to help figure this out. And so Byron, I'll let you speak.
Mr. Matthews.
Chairman, members of the committee, one of the key things that's been mentioned a lot, and I want to elaborate on is a philosophy that we talk about. If we can prevent the transport, we can prevent some of those additional costs. It's very expensive to go from your home to a care facility, whether that's a hospital and urgent care, whatever that looks like. It's a very expensive thing. So when we talk community paramedicine, we talk about community involvement, we talk about community engagement. This is an opportunity where we bring our EMS, we bring our fire service, we bring our hospitals or healthcare systems together. We bring our mental health aspects, and we provide a service to the community that's aging in a population, that we keep them in their homes. It may be as simple that Mrs. Smith, which is forgive me, I use a fire service term. Every one of our customers is Mr. and Mrs. Smith, and their children are little Wolfgang. That being said, if we take that opportunity to work with them in their home, they don't activate 911. Thus, we bring the costs of the overall system down. But in order to do that, there is also an associated cost of community paramedicine, that reach out, those collaborations. Now, yes, we can bring the private side of that together, and that's a very cooperative system because we are saving them money. So they have an incentive to participate. But it's also a matter of changing the culture of what we do. Instead of responding to everything, now we are proactively seeking to protect our community.
Very good questions. Go ahead, Representative Warnock.
Thank you, Mr. Chairman. Thanks for that thought, because there are a lot of things that we can do. And honestly, I think that both sides of the table are somewhat hamstrung on this. We're hamstrung because the society has changed in our volunteer aspect, which we've heard. We're hamstrung on this side of the table a little bit because of what we can do for funding local issues. So, I appreciate some of the things you've said. Now, this might go back, and I'm not sure if you would have an answer for this. It's back in the research paper that we got, but there was a EMS Stability Trust Fund set up in 2009 with $500,000 from the Tobacco Trust Fund. I'm curious where that fund is at financially right now, and how much of that fund has been or is being utilized for grants and things like that. I understand that this is some of this is a matching grant type of situation where the counties or somebody have to put in 50-50 maybe, or whatever the thing is. But just curious about more information on that specific fund in funding some of these difficulties that you guys are facing. Thanks.
Ms. Davis.
Chairman Baldwin, Representative Hornock, I do not have that information. I think if we have any of our partners from the Department of Health would probably be the ones who have that information, possibly. I do know that some of that is done for training, and but I can't answer that specifically. I would defer to the agency for that.
I believe we have somebody from the department online. Let's let them in and see if they can answer that question for us.
Right.
Can I have a follow-up?
Yeah.
Go ahead and ask what we're trying to get them in.
Mr. Chairman, so a follow-up on that, in the research, section, it talked about, so the fund was started with $500,000. There's been a company hired, Safe Tech Solutions, that's been hired to do some, assessments. I guess, are you also aware that Safe Tech Solutions over the past 5 years, basically, has been paid over $270,000 to do some type of assessment? I'm curious what, that's quite a bit of money going to a consultant to tell us what's being done with this fund. I don't know, but that's over half of how the fund was started, not going to essential services, going to a consultant to tell us something. I'm curious about that as well.
If you have an answer, Ms. Davis, I think we're still trying to get someone in.
Chairman Baldwin, Representative Hornock, again, I'll defer that to the agency. They're the ones who contract with Safe Tech and could give you more details of what that contract does.
Okay, I believe we have Ms. Pyle. And Stephanie, if you can hear me, go ahead and jump in here in the room with us and give us any of those answers you may.
Good afternoon. Good morning, Mr. Chairman. Can you hear me okay?
We can, go ahead.
Great, thank you. Well, good morning, everyone. Stephanie Pyle, I'm the Senior Administrator of the Public Health Division with the Wyoming Department of Health. And I have some members of my team who are also trying to get on at the moment, who are having, I think, a slight technical difficulty, but should be on here momentarily. So that trust fund was established, it's my understanding, to be able to provide some technical assistance to ambulance services. And we do that through a contract with an entity called Safe Tech, who can go in and do assessments for different ambulance services to help them identify any efficiencies or issues that they may be struggling with. And I'm hoping that my team member is now on. Aaron Kaler is joining us, and I think he can provide the committee with a few more details on that specific question. So Aaron, have you been able to join?
I believe I see Aaron on. Go ahead and join us, Aaron.
Yes, thank you very much. Yes, my name is Aaron Kaler. I'm the unit manager for the Office of EMS here at the Department of Health, the Public Health Division. Yes, the funding has been 100% allotted, or we've been given the direction that we can only use that for the needs assessments. And so there isn't really any other way that we could utilize those informations to utilize that money for any of the essential services that you spoke of.
Okay, any further comment? Representative Hornock.
Thank you, Mr. Chairman. Could you say that once again? I didn't catch everything you said. The fund is not available for some things. I'm sorry. Could you just say that again?
Go ahead, Aaron.
Yes, Mr. Chairman. Yes, so the fund has been directed to be only utilized for the needs assessments for EMS for the community needs assessments, and also the implementation of those the findings of those needs assessments.
Okay. Thank you very much for that. Okay, anything further you wish to add to that, Ms. Davis?
Chairman Baldwin, the other thing that I just wanted to add in relation to some of the county conversations that we've had is when we think about EMS services, although they're county-based and taxation at the county level with some of the districts and that they have, one of the issues that's been brought up through the county commissioners in the association is that you may have one county who is successful in getting some sort of taxation passed, but you're also, because of our roads, they're the responders for accidents and such. So they're also responding to, all of us who are traveling across the state who, maybe we reside in Laramie County, but we have an accident here in Uinta County. And so we're utilizing Uinta County resources, but not necessarily paying into Uinta County. So that is one issue, as well as, and I think you all heard in the last committee meeting that we had up in Casper about the issue of staffing I-80, especially staffing I-80 in the winter. And a lot of those are commercial truck drivers that are utilizing our interstates and that we're servicing with our local resources as well. And we did pull some data, some traffic and accident data related to how many accidents we have in Wyoming, how many require an EMS response, how many of those are out of state individuals that have required a Wyoming EMS response. And it's a substantial percentage of not only are our counties serving their local individuals, but they're also serving with their resources those who travel in and out of Wyoming. So another thing for us to just consider in the discussions as we have this, there are others beyond just our own residents of Wyoming that are utilizing our services, just as we all do when we travel into other states as well. So I just wanted to bring that up as that has been some of the county discussion as well.
Very good. Thank you, Ms. Davis. Go ahead, Senator.
Thank you, Mr. Chairman. I'm looking at the EMS Sustainability Trust account. And it was established, it was an enacted bill in 2000. I thought it said 2009. What's interesting about it, it's grants for needs assessments to determine possible solutions. And in parentheses, it says a master plan for sustaining emergency medical services in local communities or service areas. Grants to assist community in implementing a master plan. If we spent this money on determining what a master plan is, how come we don't see anybody here testifying about a master plan that we spent money on? This is an executive branch function that was funded. And I didn't know anything about it until another question was asked and I looked it up here. So it seems like there should be a master plan somewhere in the executive branch. Do we not have one?
You can answer that if you will. I will remind the committee, this was 14 years ago. So you may or may not have knowledge of that, but go ahead, Ms. Davis.
Senator Baldwin, yes, before my time for sure. Senator Bouchard, I would also defer that back to the Department of Health. I am not sure with the needs assessments that they do. I would assume that there's also a planning portion behind that. And I don't know if it's county specific based on request or if it's every county. So I would defer that to Aaron or Stephanie to see if they can answer that further for you.
And I notice we have Scott Logan on as well. I saw his face there. Any one of the three of you wish to jump in here and give us more information, or Doug is here as well.
Senator Baldwin, Senator Bouchard, we actually have posted every single one of our master plans on our website as soon as the assessment has been completed. Each one of those has been, they are agency and community specific. But I'd be more than happy to provide that link.
Very good. Any further comment on that? I don't believe so. Okay, committee. Oh, go ahead, Representative Ward.
Thank you, Mr. Chairman. I also did not know about this fund and was researching, just sitting here. I found a document on wildleg.gov that said the proposed budget for 2022, 2023, and 2024 was for 15 million, but it was approved at 10 million. So what is that approved for? And again, the title of this document is EMS Stabilization Fund.
I believe that was the ARPA funds, if I'm not mistaken. Can you elaborate on what that was used for, what it was for, Ms. Davis?
Chairman Baldwin, Representative Ward, that was the ARPA funding that was put through the legislature that was used to, there were several buckets that year for EMS. that particular bucket for stabilization was distributed into each of the ambulance services, the EMS services across the state to help stabilize them and their workforce while we continue to work on these EMS issues. So it was similar to the other healthcare stabilization funding that was distributed during COVID. And the Department of Health was tasked to that and distributed that across the state based on a formula to each of the entities who used that. So again, I would defer to Department of Health to elaborate on a few more details on that if you'd like more.
Aaron or Stephanie, anything you'd like to add to that conversation about those ARPA funds?
Mr. Chairman, Ms. Davis summarized that quite well, but we're happy to provide any additional information or detail if the committee has any on those ARPA funds that the legislature approved.
Very good. Committee, I propose that we go ahead and move forward and work the bill. Oh, we got one more question down there.
Thank you, Mr. Chairman. I just wanted to emphasize it includes fiscal years 2022, 2023, and 2024.
Okay. That being said, okay, committee, I propose that we go ahead. We'll take limited testimony from those who have pre-registered, those who are aware, who are listening online, that you have to register the evening before the meeting in order to testify here, particularly when we run shorter time. If sometimes when we have more and more time, we can be more lenient with that, but right now, only those who have registered the night before. So Katie. Stephanie Pyle, go ahead.
Mr. Chairman, thank you. I just have one brief comment that the department would like to offer on this proposed bill. And if the legislators do pass this legislation, we're happy to carry it out. The one item I did want to mention is that our Office of EMS is a very small but mighty team. We only have 4 people in that office. And so I don't want to get ahead of the conversation by talking about an appropriation, but certainly depending on the size of the appropriation, it may be necessary for us to ask for some staffing support. As the committee can imagine, it's one thing to carry out a grant of, say, $25,000. It's something different to carry out a grant of, say, 25 million. And so I did just want to put that on the committee's radar that depending on the size of the appropriation, if this bill should move forward, it may be necessary for us to ask for some staffing support. And that's all I really wanted to add at this time on the bill.
Okay, appreciate that input. And if this bill does move forward and we do sponsor this committee bill, it will be reviewed for appropriations. So that would come before us at that time. Is there any further public testimony? If I got a hand raised.
Mr.
I think that's all that had registered to testify. So we're going to close that to public input committee, discussion committee on the bill, or what is your pleasure on the bill committee? Anyone wish to move that bill committee? Go ahead, Representative Warren.
Yeah, I've got some discussion. So I think
Mr. Hornock, Representative Hornock, before we do that, if nobody's going to move it, discussion would be out of place. So does anybody want to move that bill?
I'll move with them for discussion.
Moved by Senator Doxter. Anybody wishing to second that so we can move it for discussion? Seconded by Representative Ahern. Okay, Representative Warnock.
Thank you, Mr. Chairman. So on this bill, I fully would agree that we can do a little bit. We can do some things for EMS. Obviously, there's some shortfalls in EMS. I think, like I said earlier, our hands are a little bit tied when it comes to what the state agency on our side of the table can do to fund a local entity. And a couple of points, we passed a bill last session that hasn't even been enacted yet, so that we don't know if that's even going to help or not. Some of this stuff I think we're jumping the gun a little bit on some of this. So making EMS an essential service, I think in order to move this bill forward, we would need to know what the fiscal impact would be of this bill, and we don't have that. We haven't heard that in any way. I think there's some funds going to various things that we could probably look at that might help. I mean, I'm a little bit frustrated with a trust that we set up that so far has just gone to reports to a agency out of Minnesota, I think, or something. And you know, the state has paid that agency millions of dollars actually to do assessments in various things. So this is another one of those little pieces of the pie that the money doesn't actually go to an essential service in the state. It goes to some agency outside the state. You know, I just don't think that this, until we have more information about how much we're talking about here. Are we talking 25,000? Are we talking 25 million? And are we talking increasing staffing in the health department? There's just so many things about this bill that I don't think right now this is the right solution. So I would recommend that this committee you know, not follow up on this bill in particular. Thank you.
Thank you for those thoughts. And I would add to that some of the financial things, some of the cost appropriations, we wouldn't know until it actually came before a committee, be that House or in the Senate, because it hasn't been applied yet. But those are all good points. Senator Bouchard.
Thank you, Mr. Chairman. You know, I'm having a problem with the constitutionality of the bill. So Article 3, Section 27 has a big catch-all, but it sums up at the end of it. It says in all other cases where a general law can be made applicable, no special law shall be enacted. And we have Senate File 43 with the EMS districts, and we have Senate File 100 with special districts for emergency services. Those things aren't being utilized. And now we're coming back with an appropriation to the local municipalities or counties with an appropriation bill. We're saying it's essential. I don't think that answers the question. Are we going to place this in with fire departments? I think that is the real question that we have to come up with, and we have to bring a solution to do that, because we have fire departments that regularly respond to those EMS calls, and then you have an ambulance that shows up as a secondary. And so, I mean, if I've done some ride-alongs, I've seen exactly how that works. We have a full engine runs out to a call in many districts. So we have double cost in some cases where we have the fire department making that call, and then we have EMS responding as well. Maybe private, maybe some other hospital districts doing that. So there is an apparatus that, I mean, we were told that these districts this was going to save our world. And that is the avenue for these counties to get the funding. If the 4 mills isn't enough, that we've put the limit in Senate File 43, then we got to come back to the table and figure out what that number is. But I think that appropriating in this bill, when there's ways to appropriate that are already in statute, is a constitutional violation under Article 3, Section 27.
Thank you, Senator Bouchard. Not to oppose that view, but to point out that Senate File 43 made available to special EMS districts. It has not had the opportunity to be, because that takes the county commission to constitute that they want to have that election in their district. Then it takes the vote of the people. We're looking at probably at least 2 year, perhaps longer, before we can see how much that will work. I know there's 2 districts considering it right now for sure. But I would just caution the committee, we're not going to see results of that for down the road for a little while, because that's going to take a while to do. And I will tell you up front that if we wait until we see whether that works or not, we may well lose some EMS districts. We have several that are teetering on the edge as we speak in small communities, and we may lose some EMS services. I mean, weigh that as you will on your vote on this, but that's important that Senate File 43 is going to take a while to enact and take effect. So keep that in your mind. Further comments, committee? One more comment. Go ahead, Senator Short.
Mr. Chairman, I just want to follow up on that. I mean, if we want to appropriate, we can do that in the budget. I mean, that can be given over to the executive branch and they can distribute that. I just don't think we need special legislation to go over this. And one of the questions you heard me ask is, have we had this discussion in open committee at these county meetings? And that really was not a very positive response to that answer. So I think we're working on the wrong end of this.
Okay, Senator Dockstader, you got something?
Not to put our legal team in uncomfortable position. The question is the legality of it, the constitutional legality of it. Any comment from that table or?
Go ahead, Ms. Johnson.
Mr. Chairman, Senator Dockstader, as this bill went through review, no constitutional issues came forward. I haven't had a chance to really dig too deep into Article 3, Section 27 at this point, but there weren't any constitutional concerns as it was going through review.
Thank you.
That's all I can really say.
Thank you, Mr. Chairman.
Reference to some of the funding areas, that's some of my biggest concern. We talked about grants earlier in the history of EMS. We talked about the millions appropriated for 2022 through 2024 and the trust fund without really knowing where that money has gone or is going. I think it's important that we're provided information about, and even the fire departments or EMS departments, where's that money gone? So that we can make an informed decision. What if the money's just sitting there and they don't know how to actually access it? What if someone's embezzling it? We just don't know. So with millions out there on the table, I think I too am in doubt about this bill. And that's basically it. Just would like to get more money on more information on where the money is gone that these people need. Thank you.
Go ahead, Co-Chairman Swanger.
Thanks. And I just, Mr. Chairman, need to maybe bring it back on the philosophy behind what we're doing. So I think it's 7 states, maybe more, at a county level, declare EMS as an essential service. And this is usually in utility law. Water is an essential service. We have a lot of conversations of internet broadband is essential. Is it not essential for, you know, the basics of being a Wyomingite? Should everybody have access to EMS services? They do for fire, they do for police, but from what I understand, there's no requirement anywhere in our laws that when you get in a car accident on the interstate for the ambulance to come say hi and pick you up. I mean, it's kind of this expectation. The police have to come out an accident report according to law, but there's nothing in our laws that says the ambulance has to come get you. It just is kind of assumed. And so what making something an essential service becomes is saying there's a fence, a floor, a requirement that you have to be provided EMS services under our law, and we would have to fund it. That's what the funding account comes from, is saying if the legislature finds, the state of Wyoming says EMS is essential, then no matter what, it has to be paid for, right? Otherwise, you can lose a local ambulance district. You can lose an EMS. You can't pay for it. They decide they don't want it. Tough. No ambulances anymore in the county. No EMS services. What this bill says is no matter what, we guarantee in Wyoming that you will have EMS coverage. And then ultimately, if you don't have it, someone says we're getting rid of it, there would be, the state would be required, I guess, to fund it. A court case would happen. We would say it's essential, whatever it is, county or city or state, somebody has to fund it, like education, like water to people's homes. So that's maybe 2 parts of the bill, what that funding requirement floor is. But ultimately, the question before you on, is it essential service or is it not? You know, is it, right? Do we believe that when you call 911, you get in a traffic accident or you have an emergency at your house, that an ambulance has to come, an EMS person has to come, firefighters have some training, police have some training, but do we believe in Wyoming that the EMS has to show up? Maybe we do, maybe we don't, but that's the question before you. And if we believe that, yes, every Wyomingite expects an EMS provider to come and either transport them, treat them, help them, there's going to be a cost associated when push comes to shove about how to pay for that. So I don't know if we've exhausted all opportunities of funding, of regionalization, of finding cost Consolidations, I don't maybe think we have. I think it's a larger conversation. So I'm not sure the budget part needs to stay in the bill, but for today, but the question before you is, do we believe this is essential in Wyoming that people have access to EMS coverage or not? And I'm still struggling if I do believe that, right? You heard people testify, they'll just jump in the car, have their neighbor drive them into town or to a hospital. Maybe in some places that's the right response. If people don't want to pay for the government service, I think that's the right. But that's, I think, the question where the bill is, and we've kind of gone into the weeds or steered off course, but that's ultimately why the bill's before you. In Wyoming, do we believe that EMS coverage is essential or do we not? Is it up to a county or a city?
Thank you, Co-Chairman. Further discussion before we vote on this committee? See no further discussion. Let's have a vote on this. This would be to sponsor this bill, which is 24 LSO 0019 EMS Essential Service Grants as a committee bill for the 2024 session. This will be a roll call vote.
Mr. Chairman, roll call vote for 24 LSO 0019 EMS Essential Service Grants. Senator Barlow,
Aye.
Senator Bouchard,
No.
Senator Dockstetter, Senator Hutchings, Representative Chadwick, Representative Klauston,
Aye.
Representative Hornock,
No.
Representative O'Hearn,
No.
Representative Penn,
No.
Representative Trujillo,
No.
Representative Ward. No. Representative Yin,
Aye.
Co-Chairman Wanetzer, Chairman Baldwin, seven to seven.
7-7, that bill fails. Committee. 7 to 7, that's the first time we've had a full committee on vote. Congratulations, committee. Okay, what we're going to do is we're going to take a 10-minute break here. Actually, a 9-minute break. I want you back at 11:30. We'll do 2 bills. And then we are going to be taking lunch today. Hopefully we'll only work a short time after lunch, but right now let's take a 10-minute break. We will come back and hear property tax exemptions and rehiring retired firefighters. Started. Okay, I believe we're live. Committee, welcome back. Some people who talked through the break had to leave for a few more moments, but we have a quorum. So we're going to get started. Again, chairman's prerogative. I changed my mind in how we're going to do these. We have 6 bills that are related to firefighter retention. What we're going to do is we're going to have LSO just go through and present all 6 of those bills to us. And then we'll break them down and discuss them as we go through. But let's just get them all presented at once. And then we'll vote on them and discuss them as we go through. And if you have any questions of LSO committee, you can ask him generically while she's up here. But otherwise, specific questions we'll address to the specific bill as we go through them. Thank you very much for entertaining the prerogative of the chairman. I'm trying to figure out the smoothest way to get through these. Go ahead, Amber.
And Mr. Chairman, I do have a memo regarding the property tax exemption and the Hunters Week. You want me to go through that first?
Please.
Okay, thank you. So you have a memo on the equal protection clause in Article 15, Section 11. This memo outlines potential constitutional challenges to the property tax exemption bill draft and the firefighter and EMS personnel hunting week bill draft. They may both be challenged under the equal protection clause, and then the property tax exemption bill may also be challenged under Article 15, Section 11 of the Wyoming Constitution. So the 14th Amendment of the U.S. Constitution prohibits states from denying any person within its jurisdiction the equal protection of the laws. The Wyoming Constitution offers more robust protection against legal discrimination than the federal Constitution due to provisions requiring uniform application of the laws and prohibiting special legislation. Equal protection doesn't prohibit the classification of persons and things for the purpose of legislation, but the classification must be reasonable in light of the goal to be accomplished and must not be arbitrary. If the state law affects an ordinary interest, the Wyoming Supreme Court applies a rational relationship test. And under that test, for a law to single out a limited class of individuals, there must exist some difference which furnishes a reasonable basis for different legislation as to different classes, and the differences can be arbitrary. So in other words, to treat a class differently, there must be a reasonable reason to do that. Under the rational basis review, a court would have to determine if the purpose of these bills outweighs the interests of other people in the state who would not receive a property tax exemption or would not be allowed to hunt when EMS personnel and firefighters are allowed to. And then under Article 15, Section 11, that section requires uniform assessment of property. The proposed bill draft provides an exemption for property owned by a volunteer firefighter, which in essence results in an unequal tax treatment. Article 15, Section 12 authorizes the legislature to provide exemptions for such property as the legislature may by general law provide. Currently, there are various exemptions to the property tax, including exemptions for snowmobiles and personal property held for personal or family use that have not been challenged under Article 15, Section 11. There's a veterans property tax exemption that's structured similarly to the volunteer firefighters property tax exemption bill draft, and it's been upheld on a handful of occasions. The Supreme Court has stated that the discretion of the legislature in exempting property from taxation cannot be arbitrary, and there must be a public policy goal to support a presumption that the public interest will be served by the exemption. And since the veterans exemption cases were decided, there has been a Supreme Court case that used that exemption as examples, or those cases as examples of non-uniform tax treatment of property. However, that opinion didn't overrule the veterans property tax exemption cases. And I would stand for any questions.
Go ahead, Mr. Coachman.
So, Mr. Chairman, just say that one more time. It was challenged, but it was upheld, or it was said it was iffy, but it wasn't overturned?
Right. It was iffy, but it wasn't overturned. And I think that was back in 1987. So it's been a while.
And no significant challenges since?
No.
Thank you, Mr. Co-Chairman.
Very good. Further questions on those issues? Okay, with that in mind, let's go through all the bills.
Mr. Chairman, members of the committee, first we have the property tax exemption bill draft, which is 24 LSO 27. This bill draft provides a property tax exemption for volunteer firefighters who have been Wyoming residents for at least 3 years at the time of claiming the exemption. The staff comment on page 2 indicates that the committee may wish to consider requiring that a volunteer firefighter has been volunteering for a specified period of time and that they continue to volunteer at all times while claiming the exemption. The exemption is limited to an annual exemption of $3,000 worth of assessed value. Paragraph 1 of the bill, or paragraph 2, sorry, goes over the requirements to claim the exemption, and then paragraph 3 on page 4 indicates that after a sworn claim has been filed with the county assessor, the claimant will remain qualified for the exemption. If the claimant contacts the assessor's office and confirms that the claimant still qualifies for the exemption, the county assessor shall notify taxpayers of the exemption. And then the staff comment on the top of page 5 indicates that LSO staff spoke with the Department of Revenue concerning this bill draft's potential fiscal impact. And this is a very rough number. There's approximately 3,900 volunteer firefighters within the state. And if they all claim the property tax exemption, the fiscal impact would be approximately $797,000 or $204 per volunteer firefighter. The rest of page 5 and 6 and 7 are conforming amendments. And then the effective date is on page 8. And I would stand for any questions.
Any questions specific to that one? Mr. Co-Chair, he has that. Go ahead, sir.
I do. So I guess I have two attorneys in front of me. We tried to model the active, EMS firefighter, the draft language after the veterans exemption. And so in researching it, I know you've written a memo that it could go either way, but I guess I'm asking your professional opinion. Is it likely to be challenged, or do we think the veterans exemption settled after 30 years and this is a similar provision? I mean, I just certainly don't want to pass a law that would be challenged and unconstitutional. I'm just questioning if the veterans property exemption got upheld and this is mirrored language. Your professional opinion, is it going to pass muster or likely not?
Go ahead and weigh in.
I think that there's a chance that it could be challenged. I don't think that it's a huge chance, but I definitely think it could be challenged.
Okay, thank you. Senator Hutchins.
Mr. Chair, I can ask my question after Representative Hornock. He raised his first.
Okay. Representative Hornock, you win.
Mr. Chairman, your head was turned, but that's quite all right.
That happens here. You know, it's a flat table.
I
It's hard
know.
to see who's talking.
But you're doing a great job, so thank you, Mr. Chairman.
I paid him to say that.
Couple questions, or this is for volunteer firefighters. They have to live on this piece of property. What if there's a agricultural type of situation where they they raise cows on the side, they have a piece of property that's agricultural and I guess do we know all of the little nuances to somebody owning property? I would hope that all 3,900 volunteer firefighters in the state could qualify for something, but maybe that's actually not the case. So we're going to leave part of who we're trying to help out, kind of thing. Was that looked at all? Is there new, I know we can't solve everything, but did you look at any of that in this?
Mr. Chairman, Representative Hornock, this bill draft applies just to the primary residence of a person. I didn't look into other properties, I suppose, when I was researching this bill. So I'm not entirely sure how to, I suppose there'd probably be a way to work that in, but the way that it's written now, it's just for the primary residence.
Okay, very good. Now I'm going to turn my head this way. And Senator Hutchins is going to ask a question.
Thank you, Mr. Chair. I brought this up to Anna and I thought I would bring it up again. So Representative Monitor could understand 3913-105, the exemption for the veterans. Not every person who serves or served is entitled to that exemption. It's very clear in 3913-105 that the exemption is for an honorably discharged veteran of Indian Wars, Spanish-American War, Filipino insurrection, Boxer rebellion, Puerto Rican campaign, or First World War. Also, they've been honorably discharged from the Second World War or the Korean War or the Vietnam War, or they've served in the military service of the United States and received an armed forces exemptionary medal or other army conflict in a foreign country. So to put someone who just says, I want to volunteer to be a firefighter, in my eyes, on the same level as what these men and women did, the campaigns that they may have been forced to serve in or not, is kind of, we're not putting them on the same level. And for me, that would be why I would be against this bill. So just wanted to bring that out, Mr. Chair. Thank you.
Thank you. Further questions, committee? See none, let's move on to the next bill.
Chairman Baldwin, the next bill is 24 LSO 22, rehiring retired firefighters, continued retirement benefits. This bill draft allows retired firefighters to be rehired while continuing to receive retirement benefits. The language is modeled after 2023 House Enrolled Act number 5, which amended the Wyoming State Highway Patrol, Game and Fish Warden, and Criminal Investigator Retirement Plan to allow an employer to rehire a member without suspending the retired member's pension benefit. This bill draft similarly amends the statutes governing the Fire A and Fire B pension plans to allow individuals retired under those plans to be rehired without losing their pension benefits. It does this by specifying that rehiring shall be in accordance with the Wyoming Retirement Act, Section 93415 G through J. And for reference, the Fire A pension plan covers paid firefighters hired prior to July 1st, 1981. And then newer hires are covered by Fire B pension plan. And the act would be effective July 1st, 2024.
Questions on that bill, committee? Co-chairman Wasser.
Thank you, Mr. Commissioner. Do we allow this in other areas of state employment? I know we tried something similar, I think, with law enforcement officers. I can't remember if it passed or not, but do you know if we allow this in any other areas of our retirement system?
Chairman Zwanitzer or Chairman Baldwin, we just passed this last year to apply to police officers and other individuals under that specific retirement plan, the Wyoming State Highway Patrol, Game and Fish Warden, and Criminal Investigator Retirement Plan. That bill, it removed, I think, a mandatory retirement age and then also cross-referenced these same statutes to allow them to be rehired without losing those benefits.
Representative.
Thank you, Mr. Chairman. Remind me what bill number that was.
Yeah.
I think I have it. If you'll just give me a moment. Chairman Baldwin, Representative Ward, that is House Bill 45, and it was Enrolled Act number 5.
Okay, very good. That was a lot quicker than I could have found it. Go ahead, Senator Hutchins.
Thank you, sir. Ma'am, so the person that's rehired, they're receiving their benefits and working for the state at the same time, or they just kind of hold their benefits are just kind of held off to the side? How's that working?
Go ahead.
Chairman Baldwin, Senator Hutchings. So what 93415 does is that on being rehired, they have to make an election to either discontinue retirement benefits and be reinstated as a contributing member, or they can continue receiving retirement benefits and then not be reinstated as a contributing member. And then under those same statutes, there's a requirement that the employer pay into the account an amount equal to both the members and employers' contributions.
Gotcha.
And then there's also a requirement that those requirements have to be complied with or there are consequences.
Further questions, committee? Okay, that looks like it on that one. Let's go to the next bill, please.
Oh, sorry. This bill draft directs the state fire marshal to coordinate with the Department of Workforce Services, any other applicable state agency and persons associated with volunteer firefighting to create a film targeted at the recruitment of volunteer firefighters within the state. The film shall be no more than 20 minutes long. It shall be made available to the public upon its completion, and the state fire marshal is authorized to contract with a public relations firm to assist in creating the film. And then this is another bill where the committee needs to determine an amount for an appropriation. And this act is effective July 1st, 2024.
Very short bill.
Yes.
Committee questions. Go ahead, Senator Hutchins.
A few years back, I was on TRW, Travel, Recreation and Wildlife. And they had, I think it was called FIFI, the Film Industry Film Fund or something like that. Is that something, and I'm kind of asking maybe.
That was the incentive.
Yeah, is that something that could be utilized instead of recreating a whole new law? Just a question.
I will go ahead and answer that. That bill was specifically for the tourism industry and for advertising the state of Wyoming. I don't believe it would apply to this. I think it'd have to be totally separate. Go ahead. I can barely see a representative.
Thank you, Mr. Chairman. You know, I'm in support of anything that highlights the need for community and volunteerism in our state, and especially in this area that we're so shorthanded. Has there been any discussion on, I mean, a 20-minute film, how would this be used? It's just something done in schools, this is on the internet, it's before you watch a movie at the theater. I mean, what's the plan of using this film and these funds?
I think the answer is all the above. It was discussed as an internet thing, but I think the answer is all above. It can be used in fire department, schools, et cetera, et cetera. So I think that was the plan. Further questions, Representative Warnock.
Mr. Chairman, first question, do we as a body just make a determination of the amount of money to attribute to this? How does that work?
We certainly have that ability. We can set an appropriation if we wish.
Mr. Chairman, then would somebody make a motion on that? Is that how that would work?
We would, Representative, we would do that at the time we actually work the bill, not right now. But when we go through and actually work these bill by bill, that would be the appropriate time to bring up a motion.
And just a follow-up comment, Mr. Chairman. There's been some really great advertisements done recently, and there's been some very woke advertisements done recently. I would trust that the firefighters would certainly get that right for the state of Wyoming with this bill.
And actually, the person who would be in charge of putting that together is standing in the back of the room. We'll hear from him in a few minutes. Any further questions for Anna before we move to the next bill? Or that wasn't even for Anna, I'm sorry. I gave Anna credit for one she didn't do. Okay, next bill, please.
Chairman Baldwin, the next bill is 24 LSO 20, state employees leave for volunteer fire or volunteer EMS. So this act creates a new section 93107 to specify that every state officer and employee shall receive up to 24 hours of leave with pay during each calendar year to use when the state officer or employee is absent from work due to service as a volunteer firefighter or volunteer emergency medical technician in the state of Wyoming. The definitions of volunteer firefighter and volunteer emergency medical technician from section 35.9.616 apply. The staff comment explains that there are no statutes currently addressing state employee leave for volunteer fire or EMS. Section 9.2.3207 requires the Department of Administration to establish personnel standards governing employee leave time. And then the department's rules provide agencies discretion to provide an employee up to 16 hours of personal leave with pay per calendar year to volunteer for a pre-approved nonprofit. Section 2 specifies that the Department of Administration must promulgate all necessary rules to implement the act. And then there is a split effective date.
Questions, committee? See none, you're off the hook. That takes us to the next bill, health insurance for volunteer firefighters.
Or LSO, oh. Goodness, this is 24 LSO 24, health insurance for firefighters. And this bill draft would allow volunteer firefighters to participate in the state employees and officials group insurance plan. They may enroll in the group insurance plan within 31 days of the enactment of this bill draft or within 31 days of initially volunteering as a firefighter. Continued participation is limited to a firefighter who may or may not receive compensation for services rendered as a volunteer firefighter and is carried on the regular rules of the volunteer fire department, attends not less than 50% of the monthly volunteer fire department meetings, responds to not less than 25% of calls for firefighter services, is not eligible for health insurance through a government sponsored healthcare program, and who resides in the state. Volunteer firefighters who enroll in the program shall pay their entire premiums and shall not benefit from employer contributions to cover a portion of the cost of their premiums. Volunteer firefighters have to submit monthly verification of their continued volunteer firefighter status to EGI. There are concerns there. Now there is a staff comment. There are concerns within EGI that without an employer contribution requirement, only volunteer firefighters or their family members with health issues will enroll. There were also concerns that people would volunteer as firefighters when they realize that they have a major health issue in order to pay for expensive medical procedures. The committee may wish to consider giving fire departments the option of covering the employer contribution as well. And then pages 5 through 7 are conforming amendments. At the bottom of page 7, there's a rulemaking requirement, and then there's a split effective date, and I would stand for any questions.
Questions, committee, Senator Hutchins.
We went from the LSO draft 20 to this one. And I did have just one quick question, if I may. It appears on page 2 that this that in chapter 6, section 12, the state already has a way of allowing for employees to receive time off. Is that what I heard? Or is that what I'm gleaning this properly?
Going back to draft 20, is that correct?
Thank you. Yes, it's on page 2, the staff comments.
Yeah, go ahead.
Chairman Baldwin, Senator Hutchings, let me get there real quick. It's not already being done for volunteer EMS and firefighters. There's a mechanism for the Department of Administration to establish personnel standards governing leave time. And then there are rules that allow or say that the Department of Administration says that an agency head may grant an employee up to 2 days off for volunteering with a nonprofit, but it's not specific to firefighters or EMS.
And I believe the situation is where that's to the supervisor's discretion, is that we have some supervisors saying, sure, you can do whatever, go coach Little League or whatever it happened to be. And that we have others who are saying, no, we can't let you go. And the change in this bill would say, you will allow for EMS and volunteer fire activity for those hours. Is that correct?
Chairman Baldwin, I think that is correct because the rule currently uses the word may. And so that could be interpreted as discretionary, and this would use shall, so it would require that leave time to be provided.
Okay, and then back to draft number 24, health insurance. Any questions, committee? Representative Warnock.
Thank you, Mr. Chairman. So just help me understand here, this draft bill specifically talks about volunteer firefighters. And we've had a lot of discussion this morning on EMS, so ambulance service. And we do have those, throughout the state, we do have volunteer ambulance service. Are they covered under this? Is this just specific to firefighters? It seems like a lot of times well, let's start there. Are the ambulance service volunteers covered under this as well, or just firefighters?
And I would tell you before we go to the answer on this, we were directed by management council was specifically aimed at firefighters, but I would tell you that we could certainly add EMS, but go ahead and answer that on.
Chairman Baldwin, Representative Hornock, right now, this is just directed at volunteer firefighters, not EMS.
Another question. Go ahead, sir.
Yep, follow-up question. I guess this may be part of the future discussion on this bill, but there's required to have 25% respond to 25% of the calls. Do we know what number that is? That kind of seems a little bit high, maybe. I don't know if a volunteer firefighter can actually has the ability to respond to that many calls, or what's the average, I guess, if that's been looked at when drafting this bill. Thanks.
Anna, if you want to try that, you can. Otherwise, we'll get to that in a minute. But I will tell you from my experience is that it's not the same across the board. Every department is different, but every department in the state does keep track of those responses, does keep track of attendance at calls, at training, et cetera. But go ahead, Anna, if you want to jump in there, go ahead.
Chairman Baldwin, Representative Hornock, I don't have that answer, but I have a feeling the people in the back of the room might. So I'm imagining we'll get to that.
You can call it Lifeline. Okay, any further questions on that bill, committee? Okay, that brings us to the final one on the list, draft 31, hunting week for volunteer EMS and firefighters.
Chairman
Go ahead.
Baldwin, so this act requires the Game and Fish Commission to establish a date for volunteer firefighters and volunteer emergency medical technicians who are residents of the state and have purchased a hunting license to begin hunting antelope, deer, and elk 7 days prior to the regular hunting seasons established for the general population. The definitions of volunteer firefighter and volunteer emergency medical technician from section 35(9)(616) apply. Section 2 specifies that the act would apply to all regular antelope, deer, and elk hunting seasons commencing on or after January 1st, 2025. Section 3 specifies that the Game and Fish Commission must promulgate all rules necessary to implement the act. And then section 4 is a split effective date. But I would note that the substantive provisions would be effective January 1st, 2025. And I think the idea there was to give the Game and Fish Commission enough time to come up with the rules and establish the seasons.
Very good. Questions, committee? Go ahead, Representative Hornock.
Thank you, Mr. Chairman. Did we get input from Game and Fish in order to do this 7 days ahead of time? That may, I know Fish and Game, they have to staff field, they have to have the check stations, just all of that stuff. Have we had a conversation with Fish and Game of what this will do to their staffing needs and things like that? Thanks.
Go ahead.
Chairman Baldwin, Representative Hornock, we have not yet had that discussion with them.
Were this bill to move forward, we would have that discussion in February. Go ahead.
So there's constitutional issues with this.
Chairman
Go ahead.
Baldwin, Representative Klauston, there are equal protection concerns, yes.
Further questions, committee? Seeing none. On a side note, since we're talking some Game and Fish issues here, I told Chief Cooper I just saw this. If you saw in your email, the governor just announced that Eli Crumley of Pinedale won the governor's wild bison raffle. I should just shut up. I can't talk. He is a constituent, yes. So that can't be bad. Okay. That said, thank you very much for those presentations. Here's the plan, committee, is we're going to go through each one of these bills, but first I want to take any testimony just generalized on all the bills. And then if we have questions on a specific bill or need further testimony, we'll do it, but we'll go through each bill, move, not move, vote on, et cetera, each bill. But right now I want to call department, since we've got Department of Fire and Electrical Services here. Let's call Byron up here. He's standing up. He's ready to come up anyway. You can share your views on any or all of the bills, any input you might have. Go ahead, sir.
Mr. Chairman, members of the committee, I think the work that's being done, the legislation that is proposed will give us options to make things better. And I appreciate the smile from the co-chair. I'm going to keep it brief and say that, I think there's great opportunity here. It's a great dialogue and certainly appreciate it. The agency's on board to make sure that we get these things moving forward.
Question, since it was asked about budget for the film.
I do have very specific details on the budget. Bill, I would prefer if you were okay to wait till we're ready to talk about that, if that's okay.
That would be perfect. Good answer. Okay, Senator, go ahead, Senator Hutchins.
This question was on, gosh, it was on the insurance one, where it says you had to be on page 2. It talked about line 21, that the volunteer firefighter is carried on the regular roles of the volunteer fire department. Since you have this huge fluctuation of volunteer firefighters in and out, do you think that's wise to do something like this insurance program where maybe one day they're in and maybe the next day, as soon as they signed up, there's something I can't be on the regular rolls anymore. It just seems like a lot of paperwork.
Go ahead,
Mr. Chairman. So I'm going to answer that in two portions. That being on the rolls and the 50% and 25% that Representative Hornak, that all is very similar, if not identical, to the legislation that we have for the Vol Fire Search and Rescue EMT pension. So we established that expectation so that when they're on the roster and WRS does an audit, it reflects that. One of the key elements is the state records management system allows for that person that's there is working. The chiefs will attest to that. That way we continue to move that process forward. So that's for a lack of better description, that's the checks and balances. And I don't believe it is too onerous because if they do happen to leave, typically there's an onboarding process that has to come back. So it's not here today, back the day after tomorrow discussion.
Further questions from Mr. Matthews. Go ahead, Representative Warnock.
Thank you, Mr. Chairman. Thank you, Fire Marshal. A general question. So we have 6 draft bills before us. Only 2 of them include the EMS services. So generally in this, especially when we come to volunteers, a lot of these EMS and firefighters, they're in the same room together. Is this going to create a conflict? Should we add EMS into these? What's your thoughts on some of that? And I know adding EMS to some of these is a lot more people, but like I said, these guys are their vehicles are housed in the same building, and just curious if this is going to create any problems. Thanks.
Go ahead, sir.
Mr. Chairman, I think whatever we do has a potential to create those opportunities where folks are not completely satisfied with our discussion. Fire and EMS are very close. As we have looked at over time, our pension bill also reflects Vol Fire, Search and Rescue, EMT pension. So there is some discussion on some of this legislation. I think there's value in fire and EMS being together. Absolutely. There will inevitably, whatever legislation moves forward, I would anticipate that our friends from Search and Rescue are going to come back and have some level of discussion. I'm not saying we need to include that. I'm just, for the sake of dialogue, that's how those conversations have gone over time. There is very good value in bringing fire and EMS and bolstering those numbers for the great constituents of this state.
And I would add to that is that's exactly how this started. It started as fire, however many years ago that was, before my time, maybe. And then EMS was added, and then Search and Rescue was recently added. That hasn't been very long ago. So that's how that evolved. Go ahead.
Thank you, Mr. Chair. I just have a general question. I was looking at the report, and as Laramie County is struggling to find firefighters. In my district, 40% of my district are apartments, 50% are low income. how would any of these bills get you volunteers out of my district?
Mr. Chairman, sorry. So to answer that question, I will share details that were just brought to me by my staff. The Vidavoo Fire Department has partnered with Wyotech. And those individuals living in those apartments and going to school in Laramie are afforded opportunities through the volunteer fire department to provide assistance and bolster their numbers. I don't have the specific details of that, but I think the opportunity of the legislation we provide is we set our fire departments up to be successful. We set our EMTs up to be successful. So if indeed this special district did say they're already providing some level of service and one of these pieces of legislation frees up some money, that gives them an opportunity to provide a different incentive for that type of audience. So I think the success of the legislation is it allows them to manage that through their board of directors, through their chiefs, to bolster those numbers.
Follow up.
Go ahead, follow up, Representative Trujillo.
I'm specifically asking, how would property tax bill benefit my renters, my apartment people, or how the state employee leave for volunteers would benefit getting volunteers out of my district who 60%, maybe 70% don't work for the state. And the health insurance, right? You have to qualify for low income housing, which is my district. And adding this, or like, I'm specific to these bills, how do they help recruit volunteers out of my district, which is suffering volunteer fire?
So, Mr. Chairman, the specifics of that is, I think the opportunity that presents itself there is, as we look at our census data, we look at the opportunities to partner with, for example, whether that is Fire District 1, Laramie County Fire Authority, or Fire District 4, depending on how your area represents those response districts. That's an opportunity that we provide back to those organizations to work locally within their constituency to figure out what fits, what doesn't fit. Maybe there isn't something specifically in the legislation we have today that fits. However, they see an opportunity and we come back and we continue this dialogue. I think it's an opportunity to open the door.
And I would add to that, we talked about this in our April meeting, is that the one for the state, to leave for the state, is not necessarily for the state right now. It's only for the state, but it provides an example for those other employers in town, in the county, in the district, to then say, look, we're giving them to the state employees, we're letting them go. Maybe we should do that too for the benefit of our community. And that was an example. So any further questions for Mr. Matthews? Okay, sir. Thank you very much. With that, let's bring the fire chiefs back up here. And if you could relate to any or all of these proposed bills, you may even think about, you've talked with your membership, what the priorities are, or which ones might be most important, but that's up to you. But just any comments you have, perhaps answer some of the questions that have been answered. Go ahead.
Mr. Chairman, just for etiquette, do I need to introduce myself a second time? Okay. Again, my name is Shad Cooper, Fire Chief for Sublette County Unified Fire. Thank you for the opportunity to speak with you today, and thanks for the opportunity to spend some time during the interim topic to research these bills. I'll try to go through them one at a time and just provide an input on each one. The first one, property tax exemption. I think I heard Chairman Zwanitzer say that, you know, we don't want to create a constitutional issue, and I agree wholeheartedly. The intent there is to provide incentives that had legislative ability to enact, and the idea was proposed. If it's problematic, then that's the last thing we want to do is create a problem. But it would be well received, and I can attest from my own organization, our firefighters have paid close attention to this as is moving forward, and they very much appreciate the efforts of this board and the Wyoming legislature to try to work and move these things forward. The intent is that we want to recognize our firefighters and give them incentives to join the fire department and stay with the fire department. I think there's bills here that are valuable. This is one of which, but we certainly don't want to create problems from a constitutional perspective. Chris, do you want to jump in at the end or each one?
No.
Okay. Moving forward to the second one, rehiring retired firefighters. This one is you know, my organization is volunteers. They don't participate in this retirement. They participate in the volunteer retirement. So it's I can't speak to this retirement. However, what I can say is that I've spoken to many fire chiefs across the state, and there is support for this. This is something that will allow existing firefighters that serve for 25 years to continue serving past that 25-year mark. This does have support, and it's something that will address the problem that we're here today to speak to. So I'm sure.
And we will hear from Mr. Reddy on this too. He's available, I believe, on that, but we'll hear from him in a few minutes. Go ahead.
Mr. Chairman, Chris Coker, Worland Fire Chief, and Washakie County Fire Warden. In regard to the retirement bill, the opportunity to retain institutional knowledge for individuals that have served their 25 years and have maxed out their potential pension is an opportunity, essentially as a stopgap. It provides, you're not looking at people that are necessarily always on the engine or in those type areas. In a lot of cases, they may be in investigations, they may be in public education, they may be in leadership roles and administratively, but there's an opportunity to retain that institutional knowledge and continue to pass it down to the future generations in sustainability plans.
Mr. Chairman, so continuing with the next bill, the firefighter recruitment film. Thank you very much for consideration of this and for the director's comments. I would encourage consideration of a broader perspective on this. Specifically, I would recommend consideration of you know, a statewide marketing campaign designed to address a variety of different media formats. For example, billboards would be valuable, radio spots, TV spots, newspaper spots, social media, and then inclusion of this type of video, you know, on the social media. But then furthermore, if we did, you know, a broad marketing campaign, the original idea was we need to direct, you know, prospective candidates to join the appropriate volunteer fire department by sending them to a clearinghouse so they can be redirected to you know, the fire chief of you know, Sublette County Unified Fire or Worland or whatever the case may be. So I applaud the intent of this bill, and I think it's going to be very valuable and worthwhile. But I would encourage consideration of maybe a broader perspective, and then the ability for the State Fire Marshal's office to act as a clearinghouse to redirect prospective candidates to the appropriate fire department. For the next one, state volunteer leave for volunteer firefighters, or state employee leave for volunteer firefighters. This one is near and dear to me. I've reached out to again many fire chiefs throughout the state and receive a variety of different answers about how current state employees are allowed to respond to emergency incidents as volunteer firefighters. Some fire departments have told me that it's never been an issue, that their state employees are allowed and encouraged to do so. They must first, you know, the employee must have a brief conversation with the supervisor, just make sure that you know, they're not abandoning something critical, and if it's appropriate, then the volunteer has a discretion to respond. But other fire chiefs I've talked to said no, there's a blanket prohibition from responding as a volunteer firefighter when they're state employees, regardless of circumstance or severity of incident. And so I'm really happy to see this bill before the committee and consideration and discussion on the topic. I like the way the bill was written. It calls out specificity on being a volunteer firefighter or EMT. So I think it gives clarity to the personnel rule. The other thing is that it specifies 24 hours. I know in my organization, 24 hours is it's a very significant amount of time that our volunteers might be available during daytime hours, during response when it's very difficult for us to staff trucks. And so if you recall, when I provided testimony in April, I gave the example that I met with our town council and it changed the organization. It really made the town councils by making their employees available to join the volunteer fire department and then respond during daytime hours. It really made the organization able to respond during those daytime incidents where we frankly struggle to staff trucks adequately with sufficient firefighters to perform the job, and then more so to perform the job safely. So really what we're looking for here is we're asking for the state to take leadership, to adopt a policy that makes sense, that can be used as a, not only to allow state employees to respond to emergency incidents, but to Chairman Baldwin's point earlier, but we can also use it as examples that now I can come back and use this as examples for county and local governments or special tax districts, or even go to Main Street, Wyoming and talk to local business owners and say, here's an example of a personnel policy that makes sense, that we'd sure love your support with. And so that's really what we're asking for today is for the state to lead by example and specify that volunteer firefighters can respond and be supported by their agency. And really, if our government agencies can lead by example, then it really helps us to work at a local level and help, like I said, Main Street, Wyoming businesses or whatever that may be, to say, yeah, we're all in this together. We're all helping our community, and let's be part of the solution.
Senator Hutchins,
Sir, on page 2 of that bill.
please speak close to your mic. We can't hear you.
I'm sorry, on page 2 of that bill, you're only asking for 24 hours, a calendar year. And we both know if you go to a fire, you're gonna need quite a bit of time to clean up, get your gear cleaned up. You're not gonna wanna leave it smoky. If it's a 5-alarm fire, you might be there for hours and hours. Do you think 24 hours is enough per calendar year?
Go ahead, Chief.
Mr. Chairman, Senator Hutchins, I'd ask for thousands of hours if I could. I think 24 hours is a good benchmark to start with. I really think it shows intent. And the other thing is it's really intended 24 hours during working hours. It's the same volunteer firefighters are available in the evenings and the weekends, and they're going to respond to those incidents. Really, what we're asking for is the ability for the volunteer firefighter to work with the state of Wyoming to respond and really, not only during daytime hours, but sometimes when they respond to a call at 3 o'clock in the morning and they get done and they're done, they rehab the truck, put everything back in service, they're ready to go home and get an hour of sleep. Sometimes it's real difficult to get up that following morning and go to work. This would provide them a little latitude to work with their supervisor and say, hey, can I take a couple hours this morning and get a few hours of sleep so that I can come in and be well rested and be productive, for the rest of the day, with whichever representative department.
Go ahead, sir.
Mr. Chairman, under the staff comment on page 2, one of the things that we would ask that certainly be addressed is the 501c3 piece, realizing that in the volunteer fire service, you have several different ways that they're organized. They may be as a part of a county department, a special district. They may be part of a 501c3, or they may be part of a 501c4. There's multiple ways. So if we are able to leave that as a broad volunteer fire service, it would be best not to exclude any of those.
Very good. Okay, proceed on to your next bill.
Thank you for that, Chief. I was remiss for bringing that up, but my own organization is not a 501c3, and so that would actually preclude us from participation in that policy as written. All right, the I did grab one too many. Yep. Health insurance for volunteers is the next one I have up. This one I've spoke at length with many fire chiefs and county fire wardens and across the state. This one we've received a lot of support from. This is in my opinion, in my own organization is the kind of thing that will make or break the organization. It'll bring volunteer firefighters to the door, which is the original intent. We really want to encourage people to consider joining the volunteer fire department. And then furthermore, once they join the volunteer fire department, it'll keep them with the organization for extended periods of time, for many years. The ability to access affordable health care is instrumental in many of our organizations throughout the state. In Sublette County, we have several of our volunteer firefighters that are farmers and ranchers that are either uninsured or underinsured. And they're watching this very closely, and they continually ask me, is that bill enacted? And that's not how the state government works. It takes a little bit, but they're very much engaged in this conversation, and firefighters throughout the state are as well. The point that I'm trying to make is that of the bills that are in front of us, this is one that is near and dear to my heart. It's one that I think that will encourage people to consider joining the volunteer fire department, and will can encourage them to remain with the fire department for many years and be productive members of the organization. It boils down to access to affordable health care and our ability to work together and find a solution that makes sense to make that work for everybody.
I see a hand raised, Representative Warnock.
Thank you, Mr. Chairman. I had a couple of questions earlier on this, if you can comment. Part of it requires that they respond to not less than 25% of calls. Is that a good number? Just curious where we're at with that across the board for the state. Also on that 25%, would that work for this?
Go ahead, Chief.
Mr. Chairman, Representative Hornick. So under existing statutes, for a volunteer firefighter to enroll in the retirement system for volunteers, they have to attend at least 50% of the meetings, which is the language that's also included in this proposed bill. But then furthermore, there's also a legislation for presumptive care for firefighters in case they are diagnosed with cancer. And in that bill, that's where the 25% threshold comes from. And it's defined that the firefighters need to respond to at least 25% of the emergency incidents. So we don't want to create different standards that are in different bills that require different thresholds for our firefighters to perform. To answer your direct question, in Sublette County, our policies are exactly that. The firefighters have to attend at least 50% of the meetings and 25% of the emergency calls, and it works for our organization, and it actually gives me as a chief a little bit of teeth in the conversation, and say, look, here's the minimum standards that are necessary to be an active and productive member of the organization. You can certainly exceed those standards, but you will not fall below those standards. But furthermore, there are fire departments in the state that the volunteer fire departments that staff in shifts, and maybe they're on the A shift one day or the B shift another day and the C shift another day. Well, if they're on the A shift, but they miss the other two shifts, they won't have the opportunity to go to 100% of the calls that are available. And so there are some challenges with a common threshold value, but those challenges are within each of our organizations to overcome. The way we do it in Sublette County is I have 6 stations, and the way we've adopted our policy has said that you're going to respond to at least 25% of the calls that your station is dispatched to. So you're not held to the entire county's response call volume. It's only to the station that you're eligible to respond to incidents. So the summary of the answer to your question is that yes, it is a good threshold. It's something that we're currently achieving, and we don't want to muddy the waters by having different thresholds in state statutes.
Go ahead, Chief.
Mr. Chairman, and to answer several different questions that have been asked of this bill and several others. Our organization, we require 33% for calls for service. I do know that there are several districts and departments in the state that require 50, and I know of one that requires 60%. So 25% certainly is not too great of an ask. Secondly, in regards to questions about how volunteerism and how these bills will affect or help provide volunteers in specific districts that are potentially lower income populace. Your question essentially answers your question. Those individuals that are lower in income may be the ones that are seeking the second job to be able to survive and to thrive. By taking away that need for that second job, we have an opportunity to seek those individuals out as a potential volunteer. Secondly, the opportunity to get the state employees, and then moving forward to the property tax portion, it is a holistic approach that not one thing will fit every single person. But as we have opportunities to utilize different incentives to entice different individuals, we work to accomplish as a whole the stopgap of replacing volunteer firefighters within the state of Wyoming. So if we have the opportunity to take somebody that does have that lower income and offer this because they can't afford insurance or their employer doesn't provide, so on and so forth, that is a great carrot to entice them to get involved.
Go ahead, Representative Trujillo.
Thank you, Mr. Chair. The way this health bill looks, or this insurance bill looks, the volunteer is going to be responsible for 100%. Do you see that feasible for a low-income district?
Go ahead, Chief.
Mr. Chairman, Representative Trujillo, there was also discussion in there that they may open that up to allow for the representative agency to be able to cover that. That would give some latitude potentially for the jurisdiction to be able to maximize the ability of their funding to draw volunteerism to be able to fill the roles.
Okay, further questions? Go ahead, Representative Warren, or go ahead.
Thank you, Chairman. Gentlemen, do we do a physical fit for duty test with our volunteers? So just, I'm thinking we're gonna put somebody in a stressful position, a cardiac check. I mean, if someone comes in with chronic back injuries, has all this been validated before we put them in those situations?
Go ahead, Chief.
Mr. Chairman, Representative, in our organization, all of our firefighters are required to do an annual physical. It affects it fourfold. One, being one of the regional emergency response teams, we're certainly looking, we have to meet several additional needs with hazmat. It also provides an opportunity to determine whether somebody is physically fit to wear an air pack or a respirator. It meets the requirements for CDL requirements, but it also, to your point, it gives us an immediate identification of if there are health hazards or health risks that the volunteer needs to take care of to be able to be fit for duty.
Follow up, go ahead.
No, thank you. If a volunteer is injured during a call, is that a workman's compensation claim, or how is that covered?
Whichever one of you like to take that, Chief or Chief?
Mr. Chairman, Representative Clausen, yes, we provide workers' compensation for all of our volunteer firefighters, and if they're injured, it's handled just like any other employee would be.
Yeah, I concur with that. Any further questions? Okay, gentlemen, that leaves one.
One additional follow-up point on the last one. There's a staff comment from the LSO about potentially joining the volunteer fire department for access to healthcare. But only on, it sounds like on a short-term basis. I would make point that we have an onboarding process where a firefighter has to, fill out an application, do a background check, complete a recruit academy, and complete a probationary period. Depending on when they start in the year, they don't complete that period until they finish the recruit academy and are therefore qualified. And until that time, they're deemed a recruit firefighter, not a full firefighter. So there's restrictions in their response capabilities that they haven't been trained to perform and so on. And so the point I'm making is that there is an onboarding process, and for Sublette County, that onboarding process takes approximately a year to get through. And so there's probably some opportunity for us to work that an amendment in there that makes sense, that would allow for that onboarding process to be completed before eligibility or something to that effect. So just for consideration.
Very good. Okay, let's move ahead. Next bill.
The last one I have is a hunting bill, hunting week for volunteer firefighters in EMS. While I applaud the spirit behind this bill, I don't think that it would be beneficial for the Wyoming Fire Service to all take the same week off of work and be in the field for whatever hunting season that may be. But I do think there's some value in the intent of this. When we reach out to what I was mentioned earlier about a specific demographic to join volunteer fire departments as part of that media and the marketing campaign, that's definitely a large population or a specific demographic that frequently is representative on volunteer fire departments, is sportsmen, hunting, fishermen, outdoorsmen. And if there's an opportunity that we can have to incentivize that demographic to join the volunteer fire department, I think that's what we're looking for, and that was the intent of the request when we originally met with this committee in April. So what I've looked at from other states, and certainly the LSO can weigh in here better than I can, but several states, including North Carolina, South Carolina, Tennessee, Pennsylvania, New York, Oklahoma, there's several of them that provide incentives for lifetime hunting licenses. After the volunteer firefighter has met a certain threshold, they've served for however many years, then they're eligible to access a lifetime hunting license. I think that would be more in line with the intent here of the targeted demographic to encourage incentive to join the volunteer fire department, and then after a certain amount of time and years in service, then you're eligible to have access to a lifetime hunting license. And I think that would get away from some of the concerns about special class and some constitutionality issues, but I think it still serves the overall intent of targeting an intended demographic and encouraging people to join the volunteer fire department.
Very good, Chief. Go ahead.
Mr. Chairman, committee. I echo Chief Cooper's discussion there wholeheartedly. Keeping in mind that everybody is created equal, certainly in the 14th Amendment has discussion of that. Everybody also has the opportunity to serve our country. They have an opportunity to serve our communities as first responders, whether it be fire, law enforcement, EMS, search and rescue. Those are opportunities afforded to just about everybody. There's some legality issues with felonies and so forth there, but that is not something that people are prevented from accomplishing. And so that's what we're seeking to receive, is to get more people inclusive of that. So when we talk about putting our first responders on the same level as our veterans, I have great respect. I have multiple family members that are veterans. With that being said, some of our first responders, you really need to understand the totality and the complexity of the incidents that our first responders respond to. With that being said, they go to some very gory and horrific incidents and respond, putting their life in line, going through the door of burning buildings in which our loved ones certainly don't know, are we coming home that day? No different than law enforcement, no different our military. Potentially, depending on the community you serve in, maybe a little less frequent, but nevertheless, they're still accomplishing that task. I'm mindful of the cartoon by Paul Combs. He's a fire service cartoonist. And an individual asked a firefighter, what is the worst call you've ever gone on? And there's several ghosts essentially standing over the shoulder and asking, which one of us are you going to tell them about? And that's, I think that's very appropriate for that discussion.
Very good. Questions? I look both ways. Very good. Oh, I see one. Senator Bouchard.
I'd like to come back to the insurance. So do we have any numbers to know how much their premium is going to be? I mean, because they're going to have a premium they have to pay. Everyone's not going to do that. So I just want to, has there been any discussion on that?
And I would tell you, you can go ahead and answer, but we have Ralph Hayes online as well, who may help us out with that. But go ahead, Chief. Any comment to that?
Mr. Chairman, Senator Bouchard, no, I've not seen any numbers about what those premiums would be. Anecdotally, I've spoke to firefighters that have purchased help me out with off the marketplace, the availability to purchase healthcare. And heard some very scary stories about the cost of purchasing healthcare. And the intent here would be to try to access a group healthcare plan to reduce that cost. There still will be a cost, but it sounds like the expectation here would be to reduce that cost and provide affordable healthcare to the firefighters at as belonging to a larger group.
Very good. Okay, gentlemen. Have a seat back at your original seats.
All right, thank you very much.
Okay, let's bring Mr. Hayes. Is he still available?
Yes.
He is. Let's bring him in. Mr. Hayes, welcome to Labor and Health. Go ahead, sir. Tell us what's on your mind.
Mr. Chairman, members of the committee, I do have the rates available here. I pulled them up just to give you a rough idea. And for our lowest deductible option for a single, it's $1,051.88 per month and $2,436.40 per month strictly for the health, and of course dental on top of that. Now, one of the things with the employees would be responsible for 100% of that, and in the younger age categories, I would find it hard to believe that the healthcare exchange, which provides guarantee issue and premium aid for those who are in lower income, that they couldn't find something less expensive on the healthcare exchange generally than the state's plan, unless they're in an older age category and a higher income level.
Okay, any questions? Go ahead, Senator Bouchard.
Mr. Chairman, thank you. I'd like to see what that higher rate is. Because I mean, if you have those numbers, because I'm just trying to figure this out in my head, how many people will actually join into this or opt out because they just can't afford it either. So I just want to know what the high end is on those payments.
Mr. Hayes.
Mr. Chairman, members of the committee, Senator Bouchard, we really have no basis to know what kind of volume would adopt this particular plan or what age category. So that's a calculation I really can't provide. All I can provide are, which is actually on our website, the booklets on what the plan design is, and also the rates that are currently out there for those programs.
Okay. Go ahead. Representative Clausen, I'm gonna say your name this time. Go ahead.
Yeah, thank you, Mr. Chairman. I'd like to push this bill ahead as far as the insurance benefits for these volunteers. Representative Stivler had mentioned that in Utah, what they do is if they volunteer, the state pays for the secondary. So somebody would already come in with a primary insurance and then the state pays for the secondary. So that way it's helping pick up some costs from the employees. So I guess my thought is let's push this bill forward, knowing that we're gonna have some options coming up.
Very good. Oh, I see two more hands raised.
Questions, Mr. Hayes, or are we on a bill?
I'm close.
Hey, are you ready to Mr. Hayes? Question for Mr. Hayes?
No.
Nope. Question for Mr. Hayes?
No.
No. Okay, so hold your thoughts, whatever those thoughts are. Mr. Hayes, anything additional you wish to tell us before we let you go?
Mr. Chairman, I do. It's going to be difficult. Normally, we have a human resources group out there who provides the on-site eligibility notifications and also lets us know when those individuals are no longer eligible under the plan. I don't see anything in this particular piece of legislation which designates who's responsible for what.
Okay.
Representative Penn has a question.
Representative Penn.
Thank you. I just wanted to know if the state will incur any additional costs if these guys get allowed into the plan. Does the state incur cost, or is it only the participants who pay all of their premium, and is that the only cost that will be incurred?
Mr. Chairman, members of the committee, on to that particular question, we collect premiums, but the cost really isn't on so much the administration, because adding additional individuals so far hasn't required additional staff. What really comes down to is what is the claims utilization of that particular group. If we do get adverse selection within the plan, it could be quite expensive. Compared to the other entities who are part of this plan, that's something that would only be able to be determined once we have some experience behind us.
Okay, and I suspect, even though this will attract some firefighters, I suspect that a number of our firefighters who have other insurance won't be appropriate. So the numbers are determined. Representative Hornock.
Thank you, Mr. Chairman. Maybe my question is for Mr. Hayes on the insurance side of things. Just to clarify, so this health insurance is specifically for the firefighter. However, it also references our state statutes 93203, which defines what an employee is. So it adds the volunteer firefighter to our definition of what a state employee is. And under the insurance then that we give to a state employee, their family is also covered. So then would the volunteer firefighters, are we talking about health insurance to that specific individual, or because this is also tied to the definition of an employee, are we talking about we give health insurance to the firefighter and open it up then to their employee if the premiums are paid, or I'm sorry, to their family if the premiums are paid and that kind of, the spouses, families, that kind of thing? Thank you.
Mr. Hayes.
Mr. Chairman, Representative Ronak, under the terms of the policy, what happens is the employee is designated, and according to the rest of the statutes, their dependents are eligible to be added on to the employee's coverage at their discretion.
Okay, thank you. Further questions? Representative Clausen.
Thank you, Mr. Chairman. Mr. Hayes, so just to be clear, Wyoming is we're self-funded, right? So the big cost to this could be the claims cost that you referred to. So it's Cigna's our TPA, but Wyoming's actually footing all the bills.
Mr. Chairman,
Mr. Hayes.
Representative Clausen, yes, that is correct. We are self-funded, so the plan is bearing the risk for the claims associated with our membership.
Further question, committees, Senator Bouchard.
Thank you, Mr. Chairman. I want to circle back to Representative Penn's question. I think that, and I want to know too, what is the side of the state paying on that on the premium? In other words, we heard how much the premium would be, but how much of the what's the amount that the state would pay on those same figures?
Mr. Hayes.
Mr. Chairman, members of the committee, this particular statute, of course, says the member is responsible for 100%, but the rest of the participating entities are required to pay 82% of the health, preventive dental, and highest life insurance category of the coverage. So there's a fixed employer contribution, which nets the program roughly 92 to 95% participation rates within those entities.
Okay, further questions for Mr. Hayes? Thank you, Mr. Hayes, for coming and joining us today. I know we have workforce development on our workforce services on. They haven't said hi.
Okay, now do you call them? They're coming in.
Yeah, I see. All you have to do is mention them and they'll show up.
Give her a sec. 3, 2, 1.
There she is. Welcome. Go ahead and introduce yourself and tell us what's on your mind.
Good morning, Mr. Chairman, members of the committee. I'm Kari Akins. I'm the Administrator for Policy Research and Communication, and wanted to join just to see if there were any questions that anyone might have for us.
I know we had a workman's comp question. Oh, we have a question, Mr. Co-Chair.
Hey, Kari, just question. Have we ever given a workforce development grant to volunteer firefighters or volunteer EMS? Are they eligible for like workforce training, further development grants under the program? And do you know if we've ever bestowed any upon a volunteer EMS or firefighter for additional training?
Go ahead.
Thank you, Mr. Chairman. So I know that for the majority of the history of the Workforce Development Training Fund grants, those grants were only for governmental entities were not eligible. In some of the rules changes that were made last summer, there were exceptions provided for EMS and firefighters, or EMS for sure, in order to assist with their workforce needs. So I can look to see if we have any recently awarded ones. I know that in the, I believe that we provided information about, emergency services and some grants that have been provided there, but I believe most of those were around nursing, where those have gone. And that was in the memo that we provided during your first meeting. And so that was at that time, I believe, the most up-to-date information we had about training fund grants that had gone towards EMS or in that kind of healthcare, emergency healthcare arena.
Very good. Thank you. Any further questions, committee? Saying none. Thank you very much for joining us, even if it was briefly.
Thank you, Mr. Chairman.
Any other agency folks out there? I don't believe so. No. Is there any further public comment here in the room or online? Not seeing any hands raised. We got, come on up.
If we're all hungry enough, we can get some stuff moving quick.
Go ahead, sir.
Thank you, Mr. Chairman. Again, Luke Seifert with the Wyoming EMS Association. We support all of the bills that have been proposed, bearing in mind that on the EMS side, there are substantially fewer volunteer EMTs now than there were in the past. And so the impact that will make on the EMS side will not be as great as it could be, for example, on the fire side. I think that it's important to note that any efforts to improve recruitment and retention for volunteer fire and EMS will impact and benefit all jurisdictions. Yes, it may not directly address low-income recruitment, but those that live in low-income areas will benefit if others within the same response district are encouraged to volunteer, and then the numbers of volunteers surge and increase. And then the other thing that we see is, yes, there are high attrition rates, but if we look at the bigger picture and see that while somebody may move from, for example, Uinta to Campbell County, if we as a collective have done our best effort to ensure that they are within the emergency response system and desire to continue to stay, while you may not see an initial direct impact on your jurisdiction, long term we should see positive impacts across the state, and that goes the same for other states within the United States, as we see others who have high standards and support their EMS services. When they come to our state, we benefit just as much as they benefit when we send ours elsewhere. I would stand for any questions.
Very good. Any questions? See none. Thank you very much for coming up.
Thank you, Mr. Chairman.
And I would acknowledge we had Kevin Reddy online, but he didn't raise his hand. If you're not, I thought he might want to speak on the one bill. If you're there and want to speak, Mr. Reddy, raise your hand. Up, he raised his hand. He was just asleep.
Yeah, no problem. And go.
I believe I see a face. There he is. Mr. Reddy, go ahead. Introduce yourself and speak to the committee.
Thank you, Mr. Chairman. My name is Kevin Reddy, and I am the president of the Federated Firefighters of Wyoming. We represent 9 IF locals across the state, and I would lend our support to the rehire program bill that is before you. This would provide several opportunities for our retired members who have served in career departments across the state to potentially be hired by combination or volunteer departments as senior officers and chiefs, etc. Also, I would again ask the committee to consider researching and drafting legislation to look at potentially extending the 25-year gap on the pension system for our career firefighters to serve, say, up to 30 years and continue to accrue their pension benefits, which would increase retention on the career side.
Very good. Questions for Mr. Reddy? And at this point in the legislative process, we're pretty much beyond being able to research and draft a bill for a committee consideration at this point. We only have one meeting left. But what I would encourage you is, if you see a friendly face among the committee or elsewhere in the legislature, this could be considered as an individual bill. I think it does have merit, but that would be my direction at this point. Committee, any questions for Mr. Reddy? Thank you very much. We're sorry to wake you up. Thank you for coming down today. We appreciate it appearing. Anyone else online with a hand up? Anyone else we need to wake up? Going once, going twice. Public comment period is closed. Committee, I'm going to throw this out there for you. It's almost 1 o'clock. We can forge ahead and work each of these bills and get them done and get you home at a reasonable time tonight, or close to a reasonable time. Or we can take a lunch break and come back. What's the straw poll? All those who want to forge ahead and get this done, raise your hands.
I think I can do it quick.
I think we got it. Okay. What I don't want to happen here, committee, is I don't want us to get in such a hurry that we do bad legislation, or we hurriedly vote no because we want to get out of here. Let's make sure we pay due attention to each bill and that we work them correctly. They're short bills, but let's work them. Let's start at the top.
Property tax exemption.
Yes, property tax exemption. Committee, first of all, any
You already put both on.
desire by the committee? Go ahead.
So, Mr. Chairman, I'd just say this was something I requested to be drafted, thinking this would be a kind of a beneficial road forward that could help. From what I heard today, between constitutional concerns and no one wanting to get in if this is equivalent or more or less in veteran service, I don't certainly want that fight on the floor. So I'd almost encourage us to just leave this be, and today is probably not the right time to move this forward.
Further comments, committee? Okay. If that be the will of the committee, we will leave that one on the table. Okay. Let's move on to the second bill, which would be rehiring retired firefighters, continued retirement benefits. Your desire, committee. Representative Swanser.
Mr. Chairman, I would move 24 LSO 22, rehiring retired firefighters, continued retirement benefits for the 2024 budget session as a committee sponsored bill.
Second. Seconded by Representative Chadwick. Discussion committee. Hearing no discussion, let's. Oh,
Doesn't seem like it needs a lot of work. Yeah.
okay. Committee's good with a vote on that bill? No, I see a light at the end of the table. No, I don't see a light at the end of the table. Okay. Let's do a roll call vote for consideration of 24 LSO 022 rehiring retired firefighters, continued retirement benefits for a 24 committee bill. Go ahead, Ms. Katie.
Mr. Chairman, roll call vote. Senator Barlow. Senator Barlow.
Excuse that is. Are you there, Senator Barlow?
Not yet.
Not yet. We'll come back to him. We'll ask him again.
Senator Bouchard.
Aye.
Senator Dockstetter.
Aye.
Senator Hutchings.
Aye.
Representative Chadwick.
Aye.
Representative Plouston.
Aye.
Representative Hornock.
Aye.
Representative O'Hearn.
Aye.
Representative Penn.
Aye.
Representative Trujillo.
Aye.
Representative Ward.
Aye.
Representative Yin.
Aye.
Co-chairman Swanitzer.
Aye.
Chairman Baldwin.
Aye.
Senator Barlow.
Excused.
I, 1 excused.
Okay, and I'm going to ask for one public comment before we do the next bill. Mr. Matthews. He promised he would provide us with a number or a comment here real quickly.
Mr. Chairman, Byron Matthews, Wyoming State Fire Marshal. I do have a couple suggestions on the bill. I know it's early to work the bill, but we do have a couple items that become pertinent. I'll share those, and if you want the copies to work the bill, we'll talk about that once I present this.
This is on firefighter recruitment film program 26, Mr. Chairman.
Mr. Chairman, the two things I'll share is in working with our friends with Workforce Services, Kari and I had an opportunity to work through the proposed legislation. And the first thing we talk about is on the first page is providing the opportunity I'll wait till it gets to the end. Starting in line 10, striking the director of the Department of Workforce Services and then striking other. So the section would read, the Wyoming State Fire Marshal shall coordinate with all applicable state agencies and the persons associated with volunteer firefighting to create the film. What that does is not make it so restrictive that the audience that we're limited to work with within state government is just those folks. And that was, like I say, in discussion with our friends at Workforce Services. Next item is moving down to page 2, line 10. This was some opportunity that the committee talked about, and in line 10 currently reads creating the film. I would propose adding and disseminating the film specified. So this allows the opportunity that the firm we hire helps us determine our marketing, make sure that we're getting it in front of the right audience, make sure we're creating it in the right format for each of those audiences, and doesn't limit us on what that looks like. In visiting with Workforce Services, we did easy for me to say. We did not determine the number yet, but they do have RFPs that we can look at for that appropriation. So if it works for the committee, sharing those two changes, and then we could certainly, between now and Saratoga, work on that appropriation.
Committee, as we are working this bill, I would suggest that we put a number in there as a placeholder. And then when this comes to February committee, we take that suggestion, assuming this passes, and adapt it according to what they come up with for numbers. That's only the chair's suggestion, but go ahead, co-chairman Zonter.
So thank you, Mr. Chairman, and not to go in a different direction, but I on this bill, if it's appropriate for motion at this time and no one has questions.
Let's, we have to move the bill first.
I'd actually like to move this bill to our Saratoga meeting, and that would be the motion.
Moved and seconded, moved by Zonter, seconded by Doxter.
And I would do that with the encouragement that this is probably something the state fire marshal should ask for in the budget, and go before appropriations, or at least go before the executive branch. And I think by our Saratoga meeting, we might have a direct or indirect way of knowing the executive, the chief budget officer is agreeable or not, and if it should go through the proper appropriation process. I do think it's important to keep it. And that way in Saratoga, we could still move it forward as a bill. But ultimately, it's probably a better process for this specific of appropriation for a purpose to be in our budget bill, not in the non-codified law section. I think it's one of those you keep in the back pocket in case, but pushing it all the way to the budget session right now is probably not the appropriate. So that would be my motion. And then I think you'll need, if that passes, or an amendment. I guess I got a second, Mr. Chairman. So my amendment would be to add in the suggested language brought to us by the state fire marshal at this time.
Very good. Committee, any discussion on that, Senator Hutchins?
Thank you, Mr. Chair. I'm not a big fan of this, but if the fire marshal is going to, or if we're gonna push this forward, maybe there's something you could think about. You've got one 20-minute video. You want young people to be firefighters, volunteers. 20 minutes is a long time. You may want to think about 4 5-minute videos or 5 4-minute videos. That way you have some varieties, you can get a lot of stuff in there. But I think a 20-minute video, something just to consider, is way too long. Thank you, Mr. Chair.
Thank you. I just had flashback to story problems in math. 4 5-minute videos or 5 4. I'm sorry.
Yeah. 5 4.
If a train leaves a station, okay. Moving on, that is the motion and the second that we move this forward to Saratoga. Further comments, Senator
Well,
Doxter.
just even less than that, 8 minutes is standard. And the most professional people can do it in 30 seconds or 1 minute. This is way too long.
Okay, Senator Bouchard.
Thank you, Mr. Chairman. So I agree with half of what the chairman said.
I'll take what I can get.
I think that we're working the wrong end of the horse here. This thing needs to go through RFP process. And then come back to the executive branch for all we should do is come at the budget session and say, hey, we'll fund it, and then let them handle it. I think this is just too much in the weeds. We should probably just pass on this thing right now. I think we got the ideas out there. They can run with it, work at the other end of the horse.
Okay, let's go with the motion on the floor, and that is to move us to a discussion in Saratoga in September. With that in mind, committee, all those in favor for that motion, please say aye.
Aye.
Opposed, say no.
No.
Let's have a show of hands because the chair is deaf. All those in favor, please raise your hands. 1, 2, 3, 4, 5, 6 opposed. Oh, how many we have online?
1. Yeah.
1. So 7. Those opposed, say no. 1, 2, 3, 4, 5. Anybody online?
Representative Penn.
6.
And Barlow's not around.
Barlow's not here. So was that 6?
7 to 6.
7 to 6. So we will talk about this in Saratoga.
Next.
Thank you very much, Byron. Next, that brings us to 24 LSO 0020 state employee leave for volunteer fire or volunteer EMS committee. What's your pleasure? Who moved that? Representative Clausen, second.
Second.
second by Representative Chadwick. Discussion. Go ahead, co-chair.
I just want to make sure the motion is to make this a committee bill for the budget session. Is that correct, Representative Clouston? It is. Okay, thanks.
That is the motion. And second. Comments, Representative Warnock.
Well, just a thought, Mr. Chairman, but on the last bill, didn't we have an amendment that should have been voted on with that, with the changes, or did I?
Well, the motion, the bill wasn't actually moved to consider as a committee bill right now. So that will move forward to the Saratoga meeting if we move that bill.
Okay.
So hold on to that in your files because it will come back. Okay, discussion on this bill about state employee leave. Comments, committee? Seeing none, I guess. Oh, I see one. Senator Hutchins.
Mr. Chair, before we go forward, I'd like to amend it. I'd like to amend it
It's moved. It's moved and seconded already. So go ahead. What's your amendment?
on page 2, lines 3. Let's give them 48 hours. I'd like to see 50, but 48 hours. I think the time frame is way too small. We all know it takes time, a lot of time to get yourself back together after a fire or an incident. So simply, if we could, Mr. Chair, that's my motion.
Very good. Discussion on that motion. Is there a second to that motion first?
Second.
Seconded by, was that Representative Trujillo? Okay. So discussion on that. That's to change it from 24 to 48 hours. Discussion, comments. Go ahead, Mr.
I
Co-Chair.
guess, Mr. Chairman, I would say that is 48 hours would be 6 full days of work, right? Because we're talking about 8 hours. I think my overall concern is it's just prescriptive on making the executive branch do something. I think we could without any number whatsoever, but at this time, I think I'm okay with the amendment to get the bill to session, and then I'm sure the Division of Human Resources will come in and we'll have a lively discussion on, are we exceeding our authority on mandating a number of hours? I think we allow them to do sick days, bereavement, jury duty without being as prescriptive, but for now, 48 is as good as 24 and better. So
Further discussion, Representative Clausen.
Thank you, Mr. Chair. I guess, one of my thoughts with this bill is let's take it from the state to the county to the city and hopefully local employers. 24 hours, I think, is palatable to most employers. I think we start getting to 48 hours. You may have a harder time selling this across the state. So those are my thoughts.
one day every other month.
Further committee. Discussion, let's vote on that motion, please. All in favor of that motion by Senator Hutchins to extend that to 48 hours rather than 24, please raise your hands. Those opposed, same sign. That motion fails. I'm sorry, I'm not seeing things. There really are flies flying around me up here. Further amendments, committee. Question. Let's do a roll call, please, to sponsor this as a committee bill. This would be 24 LSO 0020, state employee leave for volunteer fire or volunteer EMS. Ms. Katie.
Roll call vote, Mr. Chairman, Senator Barlow. Senator Bouchard,
Aye.
Senator Dockstetter. Senator Hutchings,
Aye.
Representative Chadwick. Representative Clouston,
Aye.
Representative Hornock,
No.
Representative O'Hearn,
Aye.
Representative Penn,
Aye.
Representative Trujillo,
Aye.
Representative Ward. Aye. Representative Yin,
Aye.
Co-Chairman Waniter, Chairman Baldwin. 11 aye, 1 excused, and 1 no.
That bill 24 LSO 0020 will be a committee sponsored bill for the 24 session. Bring us to the next one, 24 LSO 0024, health insurance for volunteer firefighters. Committee, your desire. Go ahead, Senator Representative Johnson.
Thanks, Mr. Chairman. And so I think committee, I'm going to ask this to be moved to our Saratoga meeting as well, only because from what I've understood, we've talked about various options, full state health insurance, a supplemental or secondary. I think there are a lot of options out there. I think it's the right way to go, but I do think we probably need LSO to do some more research on what the options are and what the actual costs would be to the state plan, if any, and just have some Mr. Hayes and some others appear in person. I'm not ready to get rid of it, but I'm not ready to make it a full committee bill when I think there's kind of various opportunities at perhaps certain percentages, some conversation on, does an employee have to be or volunteer be there 6 months, 90-day training period. I do think there's some questions left unanswered we need answers to before making this a full committee bill. So that's my motion, is to move it to Saratoga and ask LSO to look at various research opportunities of if supplemental or secondary insurance, what that would look like, have some more people testify on what the numbers are.
Second. By Representative Ahern, discussion committee.
Mr. Chairman,
Go ahead.
we've talked a lot about insurance this week. And by creating more for the pool, we do have a lot of discussions on that. If we could create, and this is one of the main priorities for the volunteer fire department, if we can create a bigger pool for more people to be in insurance programs, it's a win-win for everybody. So I think we need to talk more about this in Saratoga. Thank you.
Further discussion committee. Go ahead, Senator.
Mr. Chairman, I originally I was a no on this bill, but I've changed my mind. I'm a yes on this bill. I mean, I looked at what's going to happen is we're getting people paying their share. It's going to add to the pool. They're not going to be a drag to the pool. It's going to create a better benefit for everyone probably. They're going to have to pay their share to be in it. They're going to receive a benefit of a discount by being part of the plan. So I think it's a good bill. I mean, I'm okay with voting on the bill now myself, voting yes now on passing the bill. So in case you want to change a motion here.
I think we'll vote on the first motion unless he wants to change it. If not, we'll vote on his motion, and if it fails, then we'll.
Even if it passed,
Mr. Chairman.
bring.
Yeah. Okay,
I don't want to change my motion. Though.
no motion changed. We need to vote
Mr.
on-
Chairman,
Oh, I'm looking. I can turn my head that way again. Go ahead, Representative.
thank you, Mr. Chairman. If possible, if we do move this to Saratoga, can I ask the LSO to also include what it would look like to add the EMS to this bill, not just the firefighters? Thank you.
Very good. So noted. Any further discussion, committee? Nobody online wants to talk? Question on that motion. All in favor, say aye.
Aye.
Opposed, say no. That motion passes. We'll be hearing that again in Saratoga.
We got a 2 now.
Okay, that brings us to our final bill, 24 LSO 0031, hunting week for volunteer EMS and firefighters. Committee, what's your pleasure? That's sort of what I suspected the pleasure would be.
We can't have them all gone the same week.
If no one's gonna move that bill will be tabled. Okay. So review what we're gonna do before Saratoga.
Mr. Chairman, we have, as to the prior authorization bill, comments on that will be sent to me by July 10th. I'll get those comments to Senator Dockstader and Representative Penn, and we'll have a working group on that. As to 24 LSO 30, which is health insurance reimbursement of overpayments, that's going to be sponsored as a committee bill. 24 LSO 14, Medicaid third-party payer conditions will be sponsored as a committee bill. The motion to repeal 352906 B and C, which is the certificate of need statute, that was requested as a bill draft, and we'll have that at Saratoga. As to the white bagging bill draft, stakeholders are also going to provide comments to me, and we'll have a working group on that. We're going to draft a bill regarding temporary licenses for nursing home administrators. There's going to be a bill draft for a motion to repeal Wyoming statute 14-1-101B6, which we discussed this morning. The organ donation bill passed as a committee bill draft and will be sponsored during the February session. The rehiring retired firefighters bill draft passed as a committee bill. The firefighter recruitment film will be discussed in Saratoga. And then the voluntary firefighter, well, let's see here. As to the volunteer firefighter health insurance bill draft, there's going to be more research done on that, and we'll discuss it more in Saratoga. And that should be everything.
Mr. Co-Chair, anything we missed?
I'm sure there's something, but no.
Okay,
Again, I think I'll email the committee on the white bagging issue. And maybe I assume we'll email the entire committee the comments if they want on prior auth and white bagging. If anybody wants to join in those conversations in August, they'll certainly be invited on this committee.
please get those comments in, and that's if anybody's listening online as well. Please get those into LSO. Okay, with that said, you have a form in front of you for your reimbursement. Please fill those out, turn those in, or you won't get paid. Okay, good work, committee. That was a good, almost full 2 days. You did good. We did some good work. We got some stuff out there. We have work to do in Saratoga. Saratoga, a previous home of mine. Please bring your fly rods, swimsuits, plan on going to the hot pool. And we will see you all in September in Saratoga. Thank you very much, everyone.